So yes, good evening, good evening. Lokhant day. Okay, this is something different from the session. Yes, Soumya, good evening, good evening. So yes, now, so this side Dr. Abhijeet, and today I will be starting with the brain stem, guys. I will be starting with the brain stem. Good evening, Samhita, Rajesh. Good evening, beta. Good evening. And in the brainstem, the topics that I will be covering up, it is medulla oblongata and the pons, guys. I will be discussing from like very basic to like advanced level today. I will be discussing each and everything regarding this. Like Shakil Ahmed, good evening, beta, good evening. Yes, good evening. So yes, I will be discussing from the parts to the external surfaces, to the internal structures, to the transverse sections, everything along with the blood supply and the applied anatomy or the clinical anatomy. Applied anatomy and the clinical anatomy. So guys, we have already like started with the brain stem earlier. So before starting with the brain stem, guys, let us just try to look at the diagram of the brain, guys, that we have drawn, right? The diagram of the brain that we have drawn, guys, and I think you guys are really aware of that. Yes. Now, guys, in the brainstem, basically it comprises of the midbrain, right? It comprises of the midbrain. Okay, we have the pons, yes, and the medulla oblongata. Okay, we have the pons and the medulla oblongata, right? So we have the medulla oblongata, we have the pons, right? The medulla oblongata and the midbrain. So basically, these are the three parts of the brainstem. So brainstem has three parts: the midbrain, pons, and medulla oblongata. From anterior to posterior, guys. Now, guys, again a very simple question. If I have to look at the posterior side of the pons and the medulla oblongata, obviously I have to remove this cerebellum. Obviously, I have to remove this cerebellum so that I can see the posterior part. Now, guys, this is something called as the sagittal section, guys. We have already discussed this is the pons, this is the medulla oblongata, this is anterior, and this is posterior. Cerebellum is located posteriorly, guys. Anteriorly, we have the pons and the medulla oblongata, no, along with the midbrain. So we have to remove this cerebellum to see the posterior side of this pons and medulla oblongata. So that is something very basics that you should know, guys. Right? So let us without wasting much more time, guys. Let us just start with this. Yes. Hmm. So brainstem day one, and the very important thing. Now, what is like the brainstem comprised of? Hmm. Osama, good evening. Good evening. So we have just started with the session, guys. We have just started with the session. So let us start with the brain stem, the brain stem, and we will be drawing a lot of diagrams today. So I would request everyone to know have the color pencils, color pens with you, so that to differentiate between all the parts, right? Now, guys, the brain stem part one. The brain stem basically comprises of, you already know. Okay, from above to downward, we have the midbrain. Then we have the pons, and the lowermost part, it is called as the medulla oblongata. Medulla oblongata, right? So this is in order, guys. This is from above to downwards, from top to below, right? Top to below, midbrain, pons, and medulla oblongata. Today, guys, we will be starting with this very particular one, that is the medulla oblongata, and then I will be discussing about this pons. Then I will be discussing about this pons. So if I just have to say about this medulla oblongata, so I can very well say that this is the lowermost part of the brainstem, right? So the medulla oblongata, yes, I can simply write it as the lowermost part of the brain stem, or I can simply say it as the lowest part of brain stem. Lowest part of the brain stem. Now, before going further, guys, below medulla oblongata, medulla oblongata continues as what? Below the medulla oblongata, it continues as what, guys? Now, let us suppose this is pons. This is the medulla oblongata, right? This is the cerebellum behind. This medulla oblongata will continue as what, guys? Will continue as what? Yes, very good, Osama Sheikh. It is the spinal cord below. So remember, guys, it continues as the spinal cord. This medulla oblongata will be continuing as the spinal cord below. So if I talk about the extent, guys, so in the medulla oblongata, you should know the extent. Extent, you guys already know what is above. Okay, you guys are going to tell me above the medulla oblongata, what is there? Dr. R.K. Sharma, good evening, beta. Above the medulla oblongata, what is present, guys? Above it is the pons, and below what it is? Below it is spinal cord, right? Yes, Osama Sheikh, very good. It is pons above. It is continuous with pons. Yes, Shrestha Pandey, very good. Continuous with the pons, and below, yes, below it is continuous with spinal cord. Continuous with spinal cord. Again, it is very important, guys, because the lower part of the medulla oblongata is the structures, like almost the transverse section will be almost same, guys. So anyways, when we are going to discuss it, so you should know that the lower part is like more connected to the spinal cord at a foramen, guys. Now, spinal cord basically begins at a foramen over here. Okay, and can anyone tell me the name of the foramen, guys? Can anyone tell me the name of the foramen through which the spinal cord is passing? Yes, spinal cord is like originating below like the level of this particular foramen. Yes, Osama Sheikh, very good. It is the foramen magnum. In the occipital bone, guys, behind we have the occipital bone, and in the occipital bone we have a foramen called as the biggest foramen, that is the foramen magnum. And through this foramen magnum, basically like the lower part of the medulla oblongata is there and spinal cord origin is there. So it is continuous with the spinal cord at foramen magnum. Foramen magnum, guys. Foramen magnum. Yes, Shakil, very good. Shrestha, Riti, very good. So that is something you already know, what is the extent, the above and the below parts. Now, guys, coming on to the parts, and these parts are like very important. Coming on to the parts of the medulla oblongata. Now, the parts are again divided into two parts I will be taking over here, right? Okay. I am dividing the medulla oblongata into, yeah, the upper half and lower half. I will be drawing a diagram for you guys, so no need to worry, obviously. So let us just first, Marlia Shiraj, very good, beta. It is the foramen magnum. It is the foramen magnum. So yes, the parts are the upper half and the lower half. Now, guys, just over here, remember that the upper half of the medulla oblongata, it is called as the open medulla. It is called as the open medulla oblongata. Open medulla. And the lower half, it is called as the closed medulla. It is called as the closed medulla, right? Now, open medulla is something, there is a ventricle, guys. Can anyone tell me which ventricle is there in this brain stem, guys? Which ventricle is there in this brain stem? You guys already know this open medulla, basically it opens into which ventricle, guys? Yes, we have the fourth ventricle, guys. Yes, very good, Osama Sheikh. It is the fourth ventricle, guys. It opens into the fourth ventricle. I will be discussing this part also. What is this fourth ventricle? So no need to worry. What is this open medulla? What is this closed medulla? Closed medulla, basically it encloses central canal And obviously the lower half, it is enclosing the central canal. Yes, obviously you can. It encloses the central canal continuous with spinal cord. Continuous with spinal cord. Now guys, the lower half, it is called as the closed medulla. When you look at the transverse section of this spinal cord, guys, in the center you always have a central canal. Central canal. When we talk about the spinal cord, okay, when we talk about the spinal cord, similarly there is a central canal in the lower half of the medulla. Okay, that is same like the central canal of the spinal cord. Okay, so we have a central canal in the lower part of the medulla also. So we will be covering this, no need to worry. Yes, yes, Maldia Shiraj, very good. It is the fourth ventricle. So let us start with the parts, guys, and let us try to draw the diagram and see how they look like, guys, right? So firstly, I will be discussing about, I hope everyone understood up till here. Just give me a thumbs up, guys. You all are here and you are listening me. You all are writing the notes along with me. Just give me a thumbs up if the audio visuals are perfectly fine from my end, and yes, please let me know. Yes. Chalo, Osama, very good. Let us now try to discuss the external features of this medulla oblongata, right? Shakil Shrestha, Osama, very good, guys. Robin Singh, Sakshi Sharma, very good, perfect, guys. तो फोरामेन मैग्नम से स्पाइनल कॉर्ड पास होता है. फोरामेन मैग्नम के ऊपर वाले पार्ट को मेड्यूला ऑब्लोंगाटा कहते हैं. फोरामेन मैग्नम के नीचे वाले पार्ट को स्पाइनल कॉर्ड बोलेंगे. ठीक है. So yes, that is something the very basic which you know, guys, right? Now coming on to the external features of the medulla oblongata. let us start with the external features of medulla oblongata. Now when we talk about the external features, guys, there are two surfaces that we have to discuss. There are two surfaces. The first one, it is the anterolateral surface. Anterolateral surface. And the second one, guys, remember, guys, yes. Yes, the second one, it is the posterior surface. It is the posterior surface. So we will have two diagrams, guys. We will have two diagrams, right? Now, guys, when I take a sagittal section, sagittal का मतलब होता है, you guys already know that there are two parietal bones, right? And they both are joined in the midline with the help of a suture called as sagittal suture, right? Now, when I cut my body from this sagittal suture, from the midline, guys, I'm dividing the body into two parts, right and left part. Now what I'm doing, I'm removing this part of my body out and I'm trying to look at the brain. Okay, I'm trying to look at the brain. That is something called as the sagittal section of the brain. Basically, I'm dividing the body into two. I'm taking this part out and I'm trying to look the body from the side. I will see the brain. Now the uppermost part, guys, you already know we have the, yes, the cerebrum. We have the, yes, the thalamus part, right? Below, guys, we already know we have this brain, the midbrain, right? The midbrain. Now, in the sagittal section, anteriorly, guys, anterior to posterior, right? आगे से पीछे की तरफ, we are looking from anterior to posterior, guys. We have this pons. Yes, we have this medulla oblongata. And behind we have this cerebellum. Cerebellum. Right? And this medulla oblongata is basically continuous with this, yes, the spinal cord. Spinal cord at the level of this foramen magnum. Right? Foramen magnum. So this medulla oblongata, firstly, I'm going to discuss the anterior part of the medulla, how it looks anteriorly. And to approach the posterior side, guys, if I want to look the posterior part of pons and medulla, what I have to do, guys, I have to remove the cerebellum. Okay, so whatever diagrams I will try to show to the posterior part, I will be removing the cerebellum. But anteriorly, we don't have anything. So anterior part, we are going to discuss like this only, right? So that is something very basics you guys already know. Firstly, I will be focusing on, guys, the anterolateral surface of the medulla oblongata. The anterolateral surface of the medulla oblongata. Now, guys, just try to see how anteriorly it looks like. ये तो sagittal section में देखा ना, ये तो sagittal section में हमने देखा, इस साइड से देख रहे हैं. अब हम आगे से medulla oblongata को देखेंगे. We are going to watch the medulla from front, how it looks like, right? Now, you guys already know. Okay. Now, first we are going to discuss this anterolateral surface. Yes. Orthopedic surgeon, you are right, but please wait for me to like complete this, and then yes, anterolateral surface. The anterolateral surface. Right? So yes, I'm just erasing this as of this, like this is not required, because you have already seen, guys, how I'm going to draw all this, right? Now, guys, you already know we have above medulla oblongata, what is located? That is the pons, right? So yes. We have something called as the pons, which is located above, right? Which is located above. And this is the basic structure of the pons in the anterior, from the anterior side. How does it looks like anteriorly? So this is the pons, right? Above the pons we will have the midbrain. Above the pons we will have the midbrain, right? And below the pons basically what we will have? We will have this, yes. Yes, we will have this that you already know, that is the medulla oblongata, right? Now guys, just try to see that anteriorly how the medulla oblongata looks like. So please just try to draw the diagram along with me. Yes. Now, anteriorly, guys, in the ventral part of the medulla oblongata, guys, closer to the midline. Now, this is the midline, guys, and this midline, it is called as the anteromedian fissure. Okay, it is called as the anteromedian fissure. Obviously, आगे की तरफ है, we are looking at the anterolateral surface. आगे की surface देख रहे हो, lateral side की surface भी देख रहे हैं. So this is a line, and obviously this is an opening. So that's why it is called as fissure. Fissure, obviously ये हमने spinal cord में भी discuss किया था. In the transverse section of the spinal cord, I have told you, anteriorly we have the slit-like opening. ये opening जैसा दिखता है, and that is something called as fissure. और बिल्कुल बीचों बीच है body के, anteromedian fissure. So that fissure, it is located in the midline. It is located in the midline. It is located in the midline, guys. Right? Now, you already know this is located in the midline, and later on this fissure, it is basically obliterated. Yes, this is obliterated by a decussation that we have already discussed. This is like, yeah, this vanishes off in the lower part of the medulla oblongata. In the upper part, it is like this fissure, and in the lower part, guys, you already know it is getting obliterated by a, yes, by a decussation, guys. And this decussation, you already know, decussation, basically when the nerve fibers are exchanging, we have already discussed this, and this is called as pyramidal decussation. This is called as pyramidal decussation, right? Pyramidal decussation. We have discussed this pyramidal decussation earlier also, guys. We have discussed pyramidal decussation earlier also. If you guys just want to see this, I'm just trying to show this, guys. If you just want to see this, yes. Can you see this? Yeah. In the ascending tracts, like we have this. Okay, let me. Now we have talked about this pyramidal decussation, the corticospinal tract. मैंने बताया था all the fibers coming from the cerebrum, guys, right? The cerebral cortex, the motor areas, they are coming into the medulla oblongata, and in the lower part of the medulla oblongata, these fibers are turning on to the other side. These fibers are turning on to the other side. That is called as pyramidal decussation. That is the fibers of the corticospinal tract. Please learn from the basics, guys. We have already discussed this. The lower part of medulla oblongata में fibers दिखेंगे ना. So that median fissure, basically it is obliterated by these fibers only, and we have discussed these fibers earlier, right? We have discussed these fibers earlier. So yes, the pyramidal decussation, and the anteromedian fissure, basically it is the lower part, it is obliterated by this pyramidal decussation, right? Now we have this, yes, foramen magnum, you already know foramen magnum, and you guys already know below this we have the spinal cord, right? So from anteriorly it is looking like this, now let us just try to see some other facts also, other things also over here. Now just closer to the midline, guys, just closer to the midline, we have these elevations, guys. We have these elevations which are like just closer to the midline. Yes, just closer to the midline in the ventral part of the medulla oblongata, you will see elevations, ubhri hui cheezein dikhai dengi, and these are something called as the pyramids. These are called as, yes, I'm writing on one side, guys, because I have to like label multiple things over here. So this is pyramids, and these pyramids are located on both the sides, obviously. These pyramids are located on both the sides, and these pyramids are nothing but the elongated elevations. Okay, these are the elongated elevations, remember, which are formed by the corticospinal tract. We have already discussed this, even I don't need to repeat this, which are formed by these corticospinal tract. अभी दिखाया था ना मैंने, just in 2 minutes before I've shown you कि वो जो fibers are a corticospinal tract के. So these elevations, right, of the pyramids or the corticospinal tract, right? देखो, जो फाइबर्स आ रहे हैं उसकी वजह से ये उभार आता है, ठीक है, उसको पिरामिड्स बोलते हैं यहाँ पे, ठीक है। वो जो फाइबर्स आ रहे हैं उसकी वजह से ये सरफेस बिल्कुल सीधा नहीं है, उसकी वजह से ये थोड़ा सा एलिवेटेड नजर आता है, दिस पार्ट ऑफ द मेडुला, एंड दैट इज समथिंग कॉल्ड एज पिरामिड्स, गाइस, द ऑर्थोपेडिक सर्जन, right? So that is the elongated elevations which are formed by the corticospinal tract, right? Now guys, now you already know basically these pyramids tract will be keep running on the same side, and obviously in the lower medulla oblongata, this is let us suppose the lower medulla oblongata, they will be decussating, like 75 to 85% of the fibers, they come on to the lower part, and this is only in the lower medulla oblongata that I have already discussed yesterday, right? It is in the lower medulla oblongata, right? That is in the lower medulla oblongata. Now so pyramids you can see only in the upper part, guys. In most of the ventral upper part you can see these pyramids, but not in the lower part, because in the lower part these fibers are coming on to the opposite side, right? So yes, that you have to remember. So pyramids are present in most of the ventral aspect of the medulla, right? Most of the upper part of the ventral aspect of medulla, not in the lower part, because they are decussating, like 75 to 80% fibers are decussating to the other side, right? Now more lateral to these pyramids, guys, remember, more lateral to these pyramids, guys, you will be having another elevation, guys, over here. You will be having another elevations over here, and this is something called as the olive. This is called as the olive. Now this now this olive, it is again an oval elevation, guys. It is an oval elevation, and remember this elevation, ये जो उभार आता है, ये जो olive बन रहा है, these elevations are formed by, okay, these are formed by a nucleus, guys. ओके इसके नीचे एक न्यूक्लियस देखने को मिलता है, दैट इज वाई ये इतना उभर के आ रहा है. सो इट इज फॉर्म बाय द इंफीरियर ऑलिवरी न्यूक्लियस, इंफीरियर ऑलिवरी न्यूक्लियस, very very important, inferior olivary nucleus, right? now इस ऑलिव, इस पार्ट को जब हम ऑलिव बोल रहे हैं, ऑलिव एक एलिवेशन है, इस पार्ट के नीचे आपको एक ह्यूज न्यूक्लियस देखने को मिलता है, दैट इज कॉल्ड एज द इंफीरियर ऑलिवरी न्यूक्लियस, राइट? सो दिस इज द वन विच इज प्रोड्यूसिंग दिस बल्ज, दैट इज द ऑलिव। ये न्यूक्लियस ये बल्ज प्रोड्यूस करता है। न्यूक्लियस की डेफिनेशन क्या होती है, फटाफट से बता दो जरा, न्यूक्लियस क्या होता है? चलो ये भी बता दो, व्हाट इज न्यूक्लियस गाइस? Hmm. Now, again, guys, you will keep calling them pyramids until the decussation takes place, right? और decussation में मैंने पहले ही बताया था कि बाद में भी like 100% फाइबर से decussate करती है। लोअर मेडुला ओब्लोंगाटा में approximately it is 75 to 85% fibers एक जगह से दूसरी जगह जाती है, from one side to the other side, right? And criss cross होता है, right? That is decussation, right? सो और बाकी जो लाइक 15 to 25% फाइबर्स हैं वो जाके लाइक इंटीरियर वो नीचे जाके उसमें क्या कहते हैं स्पाइनल कॉर्ड में डेक्यूसेट होता है, ठीक है? नाउ गाइस रिमेंबर दैट गाइस, lateral to these olives, again guys, very very important thing that I will be discussing over here. Yes, lateral to olives we will see the origin of these cranial nerves over here. Yes, we have these cranial nerves which are coming from these olives. Yes, and remember these are these three cranial nerves that you have to remember over here. Yes, we have the 9th cranial nerve, we have the 10th cranial nerve, and we have the 11th cranial nerve. Now these three are basically coming from the lateral aspect of the olive, right? All coming from the nucleus ambiguous, all coming from nucleus ambiguous. This nucleus ambiguous, it is present in the medulla oblongata. Nucleus ambiguous. Can anyone tell me what is 9th, what is 10th, what is 11th cranial nerve? Yes, Kapil, hi. So can anyone tell me the names of the 9th, 10th and 11th cranial nerve? So it is coming from the yeah, nucleus ambiguous. Now, only nerve which is no coming in between the pyramid and this olive, this is the 12th cranial nerve. This is the 12th cranial nerve. Yes, glossopharyngeal vagus accessory. Now, can anyone tell me the name of the 12th cranial nerve? Now, this 12th cranial nerve, it is coming from this. Yes, what is the structure? That is the, you already know. Let me just label it over here also. This is the pyramid, right? This is pyramid, and this is olive. Olive. So olive के side से we have the 9th, 10th and 11th cranial nerve. Between pyramid and olive, that is the 12th cranial nerve. That is right. Kapil, right. Shrestha, right. Very good. Osama, very good. Very good. Very good. We have the 12th cranial nerve. now if I just if let us assume if I'm taking a transverse section over here, guys, we can see the emerging olives and pyramids, guys. Now you already know pyramids are more closer to this anteromedian fissure. They are more closer to the midline. So the nerve which is more closer to the midline will be the 12th cranial nerve. And on the lateral sides, we'll see this 9th, 10th and 11th cranial nerve. Right, Kelvin? Very good. Very good. Very good. Right. So that is something you have to remember. Right. Obviously. Now. So I hope this is clear, guys. Now, there is something, a groove present over here. Okay, that is no rope-like bundle which is connecting the medulla with the cerebellum, and that rope-like bundle, I have to just tell you about this. That is like yeah, we have this sulcus which is like a depression which is present over here, right? I will be teaching this in head and neck. Please, if you are like don't like disturb me, the orthopedic surgeon. I don't know what's your, come with your real name, yeah. Don't try to disturb me when I'm like teaching with your I don't know, like I'm teaching something and you are asking something like way beyond. You know, some students are really over here for some kind of no drama. So please leave. Now there is a sulcus, guys, that is like more laterally and it is more posterior. Okay, and that is called as the posterolateral sulcus. Okay. Hmm. In the anterior part, just behind this, guys. Yes, we have this posterolateral sulcus. Posterolateral sulcus. Now this sulcus, it is basically the groove between this olive, and we have the inferior cerebellar peduncle over here. If I just want to show one of the peduncles over here, inferior cerebellar peduncle. Now guys, you already know this inferior cerebellar peduncle. Now behind the pons, behind the medulla oblongata, basically, and behind the pons, we have the cerebellum. We have already talked about this cerebellum yesterday. And cerebellum has three peduncles, guys: the superior cerebellar peduncle, the inferior cerebellar peduncle, okay, the middle cerebellar peduncle, and the inferior cerebellar peduncle. Now this inferior cerebellar peduncle, basically it is a rope like bundle which is connecting the medulla with the cerebellum, so that is the inferior cerebellar peduncle, guys. That is the inferior cerebellar peduncle, right? So that is something you have to remember. The inferior cerebellar peduncle, that is basically connecting this medulla. Behind we have the cerebellum, so it is onto the most posterior part, right? So that is something that you have to remember, guys, right? Now this posterolateral sulcus, no guys, it has a role, guys. Over here, if you can see this posterolateral sulcus, it is giving exit to the three cranial nerves, the ninth, 10th, and the 11th cranial nerve. From above downwards, we have ninth, 10th, and 11th cranial nerve, all arising from nucleus ambiguous, right? So I hope this the anterolateral surface is clear to everyone. The anterolateral surface is clear to everyone. Just give me a thumbs up in the chat box, guys, if it is clear to everyone, right? Just give me a thumbs up, guys, if it is clear to everyone. Now we are going to discuss the posterior surface. So we are done with this. Yes, the anterolateral surface of the, yeah, the medulla. Just give me a thumbs up in the chat box if it is done, guys. Chal, Samita, Kelvin, very good, very good. Shrestha, very good, beta, very good. Now let us try to rotate this medulla, okay, and we will now try to see the posterior surface of the medulla. Obviously, to see the posterior surface, because medulla के पीछे तो cerebellum है. So what we are doing, we are removing the cerebellum, and then we will be having an access to know the posterior surface of the cerebellum, the posterior surface of the cerebellum, right? Now, write down the posterior surface of the medulla. We will try to see the posterior surface of the medulla, and you already know that the posterior surface of the medulla, yes, the lower half, you already know it is the closed medulla. The lower half, it is the closed medulla, right? And now it is continuous with the posterior surface of the spinal cord, right? Which prevents no now there are certain features now which are present from medial to lateral. Yes. Now what is the posterior surface? We are gonna discuss the posterior surface right now. So let us. Thank you, Tanya. Thank you, beta. Now, guys, you already know we have this medial cerebellar peduncle, right? The MCB, the medial cerebellar peduncle, basically the superior cerebellar peduncle. It is, yeah, going down. Then we have the inferior cerebellar peduncle, right? So obviously on both the sides we will have the same thing, right? Hmm. We have this, yes, the medial cerebellar peduncle, and yes, that is running from above to downwards. The inferior cerebellar peduncle, that is running from below to, yes. So I have removed the cerebellum, guys. I have removed the cerebellum, and now we are going to see the posterior surface, guys. And now we are going to see the posterior surface of this. So yeah, this is something which you already have discussed before also. That is the floor of the fourth ventricle also. So anyways, we are going to discuss that. Now, we are trying to look at the lower part of the medulla first. We are going to look at the lower part of the medulla first, right? We have the middle cerebellar peduncle, the inferior cerebellar peduncle, right? The inferior cerebellar peduncle. Now we are trying to look at the lower part of the medulla. Now, over here, guys. Now you can see in the middle, guys, in the middle, okay, posteriorly, in the middle, posteriorly. Obviously, if you take the spinal cord, guys, if you take the spinal cord, posteriorly we have a sulcus, guys. Posteriorly we have a sulcus, and you already know the name of the sulcus. This is the spinal cord, transverse section of spinal cord. आगे fissure होता है, पीछे sulcus होता है, and it is called as the posterior median sulcus, right? It is the posterior median sulcus that you can see, right? These are the posterior median sulcus. So in the middle, or I can say the, yeah, we have this posterior median sulcus over here. Yes, we have the posterior median sulcus, right? Just in continuation with the spinal cord, just in continuation with the spinal cord, you can see the sulcus, right? Now, now guys, over here you will see just lateral to this particular median sulcus, you will see a tract over here, guys. You will see a tract, or I would specifically call it as a tubercle, guys. I will be calling it as a tubercle, which is like present on both the sides, right? And that is something called as, yes, the gracile tubercle, the gracile tubercle. And that is something which we have discussed in spinal cord also, the gracile tract, guys, the gracile tract, right? So guys, remember this gracile tubercle, it is nothing but it is the gracile tract only. So if you just want me to define this, it is the gracile tract. Now tubercle is a rounded projection which is no on the surface, guys. Now this rounded projection, ये जो round projection जो उभरा हुआ posterior surface पे दिखाई दे रहा है, ये किसकी वजह से होता है? ये round जैसा उभरा हुआ पीछे की तरफ, that is tubercle. Tubercle का मतलब round projections होता है. So over here, this gracile tubercle, it is basically the gracile tract, beta. It is basically the gracile tract forming longitudinal elevations, forming longitudinal elevations, forming longitudinal elevations, guys, right? So and it is ending above by this oval kind of a swelling, guys. It is ending above by this oval kind of a swelling. So that is something called as the gracile tubercle, which is present just near to this posterior median sulcus. Now guys, again, just lateral to this gracile tubercle, you will see one more tubercle, guys. You will see one more tubercle, and that tubercle, guys, it is the cunate tubercle, guys, right? You will see one more tubercle, guys, and that is nothing but the, yes, on both the sides you will see this tubercle, and that is cuneate tubercle, cuneate tubercle. Now cuneate tract, now this cuneate tubercle will be formed by the cuneate tract. It will be formed by these cuneate tract, right, forming longitudinal elevation, right? So that is again the same thing. Now This cunate tract, it is basically lateral to this gracile tubercle, forming longitudinal elevations. ये उभरा हुआ जो दिखाई दे रहा है, that is basically because of this tract. Now tract का मतलब क्या होता है, फटाफट से बता दो चैट बॉक्स में. What is tract? मैंने बताया था, ग्रुप ऑफ एक्सॉन्स है या ग्रुप ऑफ सेल बॉडीज है. न्यूरॉन के दो पार्ट्स होते हैं, सेल बॉडी ऊपर वाला पार्ट और नीचे एक्सॉन. तो ये ट्रैक्ट जो है ग्रुप ऑफ सेल बॉडी है या ग्रुप ऑफ एक्सॉन्स है. ट्रैक्ट, क्योंकि हमें पता है कि हम लोग सेंट्रल नर्वस सिस्टम में ट्रैक्ट बोलते हैं बंडल्स ऑफ एक्सॉन्स इन सीएनएस और कलेक्शन ऑफ एक्सॉन्स या forming longitudinal, guys, yes, longitudinal elevations, right? Longitudinal elevations, that is something you already know, guys, right? Now now guys, you already know we have discussed the superior cerebellar peduncle. It is converging downwards, it is going downwards. The inferior cerebellar peduncle, it is going upwards, right? And meeting with the middle cerebellar peduncle, which is more laterally placed, guys, right? Which is more laterally placed. मैंने ये कल भी बताया था, we have 3 peduncles, right? Which are connecting this, the brainstem into the cerebellum. अगर cerebellum की बात करें, guys, तो we have already discussed these 3 peduncles, guys. The superior cerebellar peduncle, the inferior cerebellar peduncle, and the middle, the superior, middle, and the inferior cerebellar peduncle. Superior basically connects with the midbrain. Inferior, the middle connects with the pons, and the inferior cerebellar peduncle connects with the medulla oblongata. Again, makes sense with the diagram also. Right, so they all are fusing along with this middle cerebellar peduncle, and they are entering into where? The cerebellum. They are entering into the cerebellum, which I have just removed from the picture. Right, I have removed from this picture. Samitha Rajesh, it is right now. Now this tubercle is basically because of these cunate tract or the gracile tract, and yeah, basically we have the nucleus which is present in these tract also, the cunate nucleus and the gracile nucleus, right? The cunate nucleus gracilis or nucleus cunatus, which is present deep to it. So that is about the simple thing that you have to learn over here, right? Now coming on to the more upper part, guys, right? The more upper part. So yes, obviously at the level of this middle cerebellar peduncle, above we have this pons, right? And below it is the medulla oblongata, right? The medulla oblongata, right? Medulla oblongata. Now, I am gonna talk about the posterior surface. Okay, the lower half I have discussed, guys. It is the lower half. It is the lower half posterior surface of the medulla. Now I will be discussing about the upper half. Now upper half, I have already told you in my starting lecture, it is like an open type of a medulla. It is like opening, guys, right? Now, so you already know, let us just write down this one word, that is the upper half. And remember, guys, the upper half, it is somewhat called as the open medulla. It is called as open medulla, right? Now, it forms the lower part of this fourth ventricle. There is a ventricle over here, and that ventricle I will be discussing in detail. It is forming the lower part of the floor of the fourth ventricle, and it is separated from the posterior surface by the pons, right? Now, remember, guys, over here. This medulla oblongata, it is basically separated from the posterior surface of the pons by some transverse fibers. Okay, they are separated by some transverse fibers, and these fibers are called as medullary stria. Okay, it is called as medullary stria, which is basically, yes, which is basically separating the lower part of the floor of the fourth ventricle, okay, and it is separated from the posterior surface of the pons, right, by some transverse fibers, and this is something called as the medullary stria, guys, right? Medullary stria. Now, you guys already know that we have see in the floor of the fourth ventricle, guys, we see the sulcus limitans, guys, Now we have something called as the sulcus limitans. Now sulcus limitans, it is basically which is dividing the neural tube. You already know it is coming all from the neural tube, guys, embryologically. It is coming from the neural tube embryologically. So this is called as the sulcus limitans. Sulcus limitans. Now, which is dividing the neural tube into the dorsal part called as an LR plate and ventral part, which is the basal plate. Now, everything which is which you see medial to the sulcus limitans, right? So that is basically like made up of basal plate only, guys. Okay, so yes, everything is like motor over here. So in the middle, guys, in the middle we have a fissure, and that is called as the median longitudinal fissure. We have a fissure over here, and that fissure, it is called as the median longitudinal fissure. Median longitudinal fissure. So I'm not focusing more about Pons over here because I will be talking about the Pons in a little bit detail, right? So I'm not focusing on the Pons over here. So yes, it is the median longitudinal fissure, guys. It is the median longitudinal fissure, guys, right? So if I'm just talking about this medulla oblongata part, if I'm just talking about this medulla oblongata part, now over here, guys, you will be watching just lateral to this sulcus limitans. Over here there will be a triangle called as the inferior fovea. Okay, this is called as the inferior fovea, guys. Inferior fovea. So this inferior fovea, what it is an inverted V-shaped depression, guys, right? And this is also called as the vagal triangle, the 10th triangle. It is also called as the vagal triangle. Okay, now why it is called as the vagal triangle? Because it cover lies the dorsal nucleus of vagus. इसके नीचे आपको dorsal nucleus of vagus मिलेगा. It cover lies the dorsal nucleus of vagus. That is important. Vagus is which cranial nerve, guys? Just tell me. Vagus is which cranial nerve? Try to answer me in the chat box. Vagus is which cranial nerve? Yes. Yes, Osama, very good. It is the 10th cranial nerve. So we have an inverted V-shaped depression, if you can just see. And this V-shaped depression, right? It is called as the inferior fovea or the vagal triangle, guys, right? The inferior fovea or the vagal triangle, right? On the sides, guys, on the sides, we have another triangle, which you can see over here, which is in the part of the pons also and in the part of medulla oblongata also. This yellow color, yes, Shakil, Samhita, Alikhya, very good. This yellow color which I have shaded, this is again a triangle over here, and that is called as the vestibular triangle. Vestibular triangle, right? So it is like lateral to this inferior fovea, this yellow colored part, which you can just see over here. It is lateral to this inferior fovea. Yes, inferior fovea is just below. Yes, this is the inferior fovea, which you can see. Yes, inferior fovea, right? Now overlies, अब इस vestibular triangle के नीचे, इस vestibular triangle के नीचे, guys, you will be having a nucleus over here. You will be having a nucleus over here, and that is called as the, yes, the vestibular nucleus. So over here basically it overlies vestibular nucleus. Vestibular nucleus, right? Nucleus. Now so yes, above to it, guys, again in the pons part we have this part over here. That is, I will be drawing it again, so that we have the hypoglossal triangle over here. This is the hypoglossal triangle. So it is like, yeah, if I just try to draw it more conveniently, yes, this is the hypoglossal triangle. And yeah, the vagal triangle I have already highlighted earlier. Yes. Hmm. So that is the hypoglossal triangle that we will be like watching it off. The sulcus limitans, guys, again, it's a part like no, which is developing um, in the floor of the fourth ventricle. This sulcus limitans, it is dividing the neural tube into dorsal and ventral parts, right? The dorsal alar part and the ventral basal part. So everything which you see medial to the sulcus limitans, everything which is medial, just towards this median longitudinal fissure, guys, right? We will have the motor nucleus in this region, right? So yes, and all the sensory nucleus will be like lateral to the sulcus limitans. All the sensory nucleus will be no lateral to this sulcus limitans, right? So again, I'm not talking about the pons, the above part. We are just focusing on the lower part. Now, if you can just clearly assume, guys, over here that in the lower part, guys, yes, we have something which is actually, you know, if you look at the inferior angle of this fourth ventricle, or like which the lower part of means the upper part of this what we say the medulla. So you guys can see it is just looking like a nib of a pen, guys, the nib of a pen, right? So this part, okay, or the inferior angle of the fourth ventricle, it looks like a nib of a pen, and that is why it is called as calamus scriptorius. It is called as calamus scriptorius, the pen which is no used to write a script. Scriptorius is basically looks like a nib of a pen. So it's the angle of the fourth ventricle also, because fourth ventricle, it is formed by, upper part is formed by the pons, the lower part is formed by this medulla, right? So yes, this calamus scriptorius is basically the one which is used to write script. So that's basically the nib of a pen. That is something called as calamus, guys, in Latin, right? So that is something you have to remember. And one more important thing that I want to highlight in this, that is again very very important, guys. Over here, which I'm highlighting in the lower part over here, right? I don't know which you're not able to see as of. This is called as the area prostinema, right? This is called as area prostema, area prostema. And remember, guys, this is the vomiting center of the brain. This is the vomiting center of the brain. Vomiting center of brain. Now, guys, one important thing, you already know that there is something called as blood brain barrier. Now there are some parts of the brain which are no devoid of this blood brain barrier, and these are called as circumventricular organs, right? And one of the region where no the blood brain barrier is absent, and that is this area prostema. That is this area prostema, guys, right? So that is something you have to remember. So I hope the posterior surface of the medulla, the posterior surface of medulla, it is clear to everyone. The posterior surface, it is clear. The upper half and the lower half. Lower half is easy, the cuneate tubercle, the gracile tubercle, the posterior median sulcus. The upper half, you can see we have these areas which you can just focus. So just give me a thumbs up if the external features are clear, guys. If the external features are clear, we have discussed the anterolateral surface and we have discussed the posterior surface of this medulla oblongata, right? So we have discussed the anterolateral surface and the posterolateral surface. I mean the posterior surface. Now, yes, the surgeon, the Shakil Ahmed, yes, Alakhya, very good, guys. Yes, Robin Singh, very good. ब्रेन में कुछ एरियाज ऐसे होते हैं जहां पे ब्लड ब्रेन बैरियर प्रेजेंट नहीं होता, और एरिया प्रोस्टीमा उन्हीं में से एक एरिया है जो ये जो पूरा का पूरा ये जो रोम्बॉइड जैसा दिख रहा है, फोर्थ वेंट्रिकल है. तो फोर्थ वेंट्रिकल का कुछ पार्ट तो मेड्यूला ऑब्लोंगेटा से बन रहा है और कुछ पार्ट ऊपर पॉन्स से बन रहा है. तो पॉन्स अभी हम डिस्कस करेंगे. तो जो इंफीरियर एंगल है, चार एंगल्स हो गए ना, एक ऊपर हो गया, दो साइड में और एक नीचे. जो नीचे वाला एंगल है उसको तो हम क्या बोलते हैं, कैलिमस स्क्रिप्टोरियस बोलते हैं. कैलिमस स्क्रिप्टोरियस बिल्कुल निब ऑफ द पेन लगती है, जिससे मतलब स्क्रिप्ट लिखते हैं ना, जैसे पेन से कुछ लिखते हैं. तो जस्ट इन लैटिन उसको ये बोला क्या. और उसी के साइड में जो इंफीरियर फोबिया का जो ये जो पार्ट होता है, दैट इज द एरिया प्रोस्टीमा, गाइस. दैट इज द एरिया प्रोस्टीमा एंड दैट इज द वॉमिटिंग center of the brain, right? That is the vomiting center of the brain, right? Now coming on to the next part, that is the internal structure of this Yes, the medulla oblongata. So we have discussed the extent, we have discussed the parts, we have discussed the external features, the cranial nerves, how they are coming out, right? And now we are going to focus on the internal structure of medulla oblongata. So please write down the internal structure of medulla oblongata. Internal, okay, structure. अरे यार. Internal structure of medulla oblongata. Now this internal structure, guys, internal structure, we are going to take three levels, guys. We are going to take three levels. I will be showing you the three transfer sections at three levels. Now guys, how to take the levels? You guys already know this structure which I'm drawing right now. Yes, it is the, yes, obviously this is the pons. राइट पॉन्स के नीचे क्या प्रेजेंट होगा? बिल्कुल रफ में बनाना है, बिल्कुल कोई जरूरत नहीं है अभी क्योंकि बहुत सारे स्ट्रक्चर्स बनाने हैं हमें. सो पॉन्स के नीचे क्या प्रेजेंट होगा? यस, वी हैव दिस मेड्यूला ऑब्लोंगाटा, राइट? ये पूरा का पूरा मेड्यूला ऑब्लोंगाटा है. तो अब इसके हम लोग तीन ट्रांसफर सेक्शन लेंगे, तीन ट्रांसफर सेक्शन लेंगे. तो ये तो पिरामिड्स हो गए, ठीक है, ये तो पिरामिड्स हो गए. एंटीरियर मीडियन फिजर हो गया और इसके साइड पे क्या हो जाता है? ऑलिव्स. इसके साइड पे क्या हो जाता है? ऑलिव्स. तो ये तो सबको पता ही है कि ये वाला जो पार्ट है, ये जो ओवल शेप स्वेलिंग्स है, इनको क्या बोलते हैं? ऑलिव्स. ये ऑलिव्स हो गए. और ये जो बीच वाला पार्ट है गाइस, यू ऑलरेडी नो दिस, that is the pyramid, right? That is again the pyramid, guys, which you can see over here. राइट. और यस, अब तीन सेक्शंस और नीचे क्या है? डेक्यूसेशन हम लोग लेते हैं ना, जो डेक्यूसेशन बन रहा था, यू गाइस ऑलरेडी नो द लेवल ऑफ पिरामिडल डेक्यूसेशन. ओके, दैट इज इन द लोअर पार्ट ऑफ द मेडुला ऑब्लोंगाटा. तो दिस इज द पिरामिडल डेक्यूसेशन. तो ये तो मोटा मोटी हम लोग को पता है, अभी हम लोगों ने ये सब कुछ पढ़ा है, जहाँ पे फाइबर्स एक जगह से दूसरी जगह जा रहे, राइट से लेफ्ट में जा रहे हैं और लेफ्ट से राइट में आ रहे हैं, राइट? Okay. Now, guys, I'm taking three levels over here. The first section I will be taking at the level of this pyramidal decussation, right? The first section I will be taking at the level of this pyramidal decussation, right? This is the first section. पहला सेक्शन मैं यहां से लूंगा, पहले यहां से मेडुला ऑब्लोंगाटा को काटूंगा और देखूंगा क्या दिख रहा है, राइट? थैंक यू इशिका, थैंक यू सो मच फॉर द लव. Yes, you're watching my lower limb lectures, but yeah, if you want to do neuroanatomy, you are most welcome over here, right? Now, the second section, guys, the second section is basically taken below the level of olives. हम लोग olives के नीचे से काट रहे हैं medulla oblongata को. We are cutting below the levels of olives, and where internally the sensory fibers are decussating. So यहाँ पे sensory fibers ना डेक्यूसेट करते हैं, एक जगह से दूसरी जगह जाते हैं, तो यहाँ पे सेंसरी डेक्यूसेशन देखने को मिलता है. तो एक ये सेक्शन लेंगे और एक सेक्शन हम लोग ऑलिव्स पे देखेंगे, एक सेक्शन हम लोग ऑलिव्स पे देखेंगे. दैट इज द थर्ड सेक्शन व्हिच विल बी सी. इट इज टेकन एट द लेवल ऑफ ऑलिव्स. एक ऑलिव्स पे से काट के देखेंगे मेडुला को, ठीक है? सो हम लोग तीन सेक्शंस में स्टडी करेंगे इंटरनल स्ट्रक्चर. पहला सेक्शन पिरामिडल डेक्यूसेशन, उसके ऊपर जहां पे सेंसरी डेक्यूसेशन हो रहा है, और वो सेक्शन हम लोग इस तरीके से लेंगे कि वो ऑलिव्स के नीचे आए. और एक सेक्शन हम लोग ऑलिव्स वाला लेंगे, एक सेक्शन हम लोग ऑलिव्स वाला लेंगे जहाँ पे ऑलिवरी न्यूक्लियस था, इंफीरियर ऑलिवरी न्यूक्लियस. तो हमने ये पार्ट तो देख लिया. तो ये तीन सेक्शंस में हम लोग को पढ़ना है. आई होप दिस इज क्लियर. थैंक यू सो मच इतना अच्छा पढ़ाने के लिए. आई एम टू मच ग्रेटफुल टुवर्ड्स योर एफर्ट. थैंक यू इशिका, दैट फीडबैक मैटर्स अ लॉट. लाइक यस. चल, इतना क्लियर है सब लोगों को? फटाफट से एक थम्स अप बता दो कि कौन कौन से तीन सेक्शंस हम लोग लेने वाले हैं. तुम्हें क्लियर हो गया है कौन कौन से तीन सेक्शंस हम लोग लेने वाले हैं? सो दिस इज लाइक क्लियर टू एवरीवन. सो चल, yes, clear Samita, very good, very good. आसिफ लाहौरी, वेरी गुड बेटा। शकील, रॉबिन, ओके 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 गाइस। हम्म, चलो लेट अस स्टार्ट। अब देखो, पहला हम लोग स्टार्ट करेंगे पिरामिडल डेक्यूसेशन की तरफ, पिरामिडल डेक्यूसेशन की तरफ। सो लेट अस जस्ट ड्रॉ द फर्स्ट स्ट्रक्चर गाइस, सब कुछ ड्रॉ करेंगे। नाउ पुट द हेडिंग एज द ट्रांसवर्स section of medulla oblongata. Alekhya, okay. Medulla oblongata at pyramidal decussation. At pyramidal decussation. Now, नीचे वाला पार्ट ले रहे हैं। सबसे पहली बात बिल्कुल ध्यान देना बेटा, अभी हम नीचे वाला पार्ट ले रहे हैं। मैंने तुम लोग को कॉर्टिको स्पाइनल ट्रैक्ट में भी बताया था। देखो अगर ध्यान हो तुम लोग को, तो मैंने तुम लोग को बताया था कि यहाँ से कोरोना रेडिएशन आती हैं, ठीक है। और ये जो कोरोना रेडिएटिंग की जो फाइबर्स हैं, ये जाएंगी इंटरनल जो जीनो ऑफ द इंटरनल कैप्सूल, ठीक है। ऑब्वियसली सेरिब्रल कॉर्टेक्स, द मोटर एरिया ऑफ द सेरिब्रल कॉर्टेक्स, यहां से फिर आएंगी नीचे, किस में आ जाती है, थैलेमस, ठीक है। थैलेमस से कहां चली जाएंगी, मिड ब्रेन, मिड ब्रेन में आती हैं। मिड ब्रेन से कहां चली जाती हैं, फिर मिड ब्रेन से कहां चली जाती है, ऑब्वियसली यू नो वी हैव द पॉन्स, और पॉन्स के नीचे क्या आता है, मेड्यूला ऑब्लोंगाटा, मेड्यूला ऑब्लोंगाटा। नाउ मेड्यूला ऑब्लोंगाटा में जब ये फाइबर्स आती हैं बेटा, ऊपर डेक्यूसेट नहीं करती, ऊपर वाले पार्ट में डेक्यूसेट नहीं करती, ये फाइबर्स नीचे वाले पार्ट में डेक्यूसेट करती हैं। मैंने बताया था 75% फाइबर्स जो है वो अपोजिट साइड आ जाएंगी। तो अब हम लोअर पार्ट ही तो पढ़ रहे हैं, तो हमें कहीं ना कहीं ये पिरामिडल डेक्यूसेशन देखने को मिलेगा। हम मेड्यूला ऑब्लोंगाटा का लोअर पार्ट ही पढ़ रहे हैं, क्योंकि ऊपर वाले पार्ट में डेक्यूसेशन नहीं होता, लोअर वाले पार्ट में होता है, लोअर वाले पार्ट में होता है। तो 75 to 85% फाइबर्स जो हैं वो आ जाते हैं, और यहाँ पे सिर्फ 10% फाइबर्स कंटिन्यू करते हैं, 15 से 25% फाइबर्स ही कंटिन्यू करते हैं, ठीक है। और फिर वो कहाँ जाते हैं, स्पाइनल कॉर्ड में जाते हैं, ठीक है। स्पाइनल कॉर्ड में 10 से 15% भी चले जाते हैं अपोजिट साइड पर, ठीक है। तो ये जो हम लोअर पार्ट पढ़ रहे हैं ना मेड्यूला ऑब्लोंगाटा का, इसकी एक फीचर तो मैंने तुम्हें पहले ही बता दी कि पिरामिडल डेक्यूसेशन होता है। पिरामिडल डेक्यूसेशन होगा मतलब जो ये जो फाइबर्स आ रहे थे कॉर्टिको स्पाइनल ट्रैक्ट के, जो फाइबर्स आ रहे थे सेरिब्रल कॉर्टेक्स से, थैलेमस में, मिड ब्रेन, पॉन्स, मेडुला, मेडुला का नीचे वाले पार्ट में ये नो दे ट्राई टू डेक्यूसेट, गाइस दे ट्राई टू डेक्यूसेट। चलो अगर इतना बेसिक क्लियर है तो फिर इसको फटाफट से बना के देखते हैं। ट्रांसफर सेक्शन अब मेडुला का देखते हैं। हमने मेडुला को बीच में से काटा और अब हम देखेंगे कि उसमें हमें क्या क्या देखने को मिलेगा। What are the structures that we will go and see? Now the lower now the features of this medulla oblongata, basically they appear internally, appear same as that of spinal cord. Now अगर मैं spinal cord की तरह बता रहा हूँ कि बिल्कुल spinal cord जैसा लगता है, at least like majority it is same guys, majority it is same guys. So you should know that yes, we have the posterior median sulcus, right? We have these, yeah. I will be like talking about these guys, right? Obviously no need to worry. So yes, so it will be somewhat like this only guys. I will be drawing only one side guys, the other side is also the same, the other side will automatically be the same guys. So absolutely no need to worry. So you can just draw a little bit more wider, right? To बिल्कुल स्ट्रक्चर्स ध्यान से बनाना, ठीक है। नाउ गाइस, नाउ ये सब तुम्हें पता ही है पहले ही कि अगर स्पाइनल कॉर्ड में अगर हम एंटीरियर टू पोस्टीरियर जा रहे हैं बेटा, आगे से पीछे की तरफ जा रहे हैं, ठीक है, तो आगे एक फिजर देखने को मिलता है, ठीक है। तो इस फिजर को हम लोग क्या नाम देते हैं, एंटीरियर मीडियन फिजर। I'm not writing like everything complete guys, you should know this up till now, right? This is the anterior median fissure, right? Anterior median fissure. We have this, yes, you already know we have this posterior median sulcus. Posterior median sulcus, दोनों midline में ही है body के ना, दोनों midline में. It is the lower part basically at the pyramidal decussation. जो lower part है medulla का, it automatically be looks the same, guys. It automatically like looks the same as the spinal cord. Now guys, we have the central gray matter and the peripheral white matter, right? Now the central gray matter, guys, has a canal. सेंट्रल ग्रे मैटर में एक कैनाल देखने को मिलता है, दैट इज द सेंट्रल कैनाल, एंड विच कंटिन्यूज डाउन एज द सेंट्रल कैनाल ऑफ द स्पाइनल कॉर्ड. मेडुला ऑब्लोंगेटा के नीचे क्या है? स्पाइनल कॉर्ड है. सो दिस इज द सेंट्रल कैनाल, गाइस. Okay, this is the central canal. I will be just writing it like this so that it's like more. This is the central canal, guys. So that is in the central gray matter. That is in the central gray matter, right? Which continues down as the central canal of the spinal cord. Now this central gray matter, okay, let me just draw this gray matter. Has got some projections, guys. It has got some projections, right? Now over here you can see that this projection, guys, yes, this projection, it is called as one of these projections. It is called as nucleus gracilis. Nucleus gracilis, and I need not have to tell you what is this nucleus gracilis because we have discussed this a lot number of times in the spinal cord. Also, I have told you this, right? So we have this nucleus gracilis, right? Now we have one of the other nucleus which you can see just lateral to it, guys. It is the nucleus cuneatus. The nucleus cuneatus. The nucleus cuneatus, right? The nucleus cuneatus, right? So which is overlapped by, know these white matter tract, the tractus gracilis and the tractus cuneatus. We already know we have this white matter. So yes, let me just highlight this over here. So we have these, yes, you already know this is, yes, the tractus gracilis, yes, and we have this, yeah, the green color which I'm highlighting, that is the, yes, you just write like this. We have this tractus gracilis and we have this tractus cuneatus. Tractus cuneatus, right? So we have this tractus gracilis and we have this tractus cuneatus, right? Now that is something you already know. Now lateral to these projections, guys, now it will be same like on the other side as well. So I'm not drawing on the other side, guys, right? So it will be like a waste of time. Now lateral to these projections, guys, we can see we have the apex of the gray matter posteriorly, okay? Now we have one more projection, guys. We can see the apex of the gray matter posteriorly. And remember, this apex, this part, okay, posteriorly behind, it is formed by the spinal nucleus. We have the spinal nucleus of trigeminal nerve. We have the spinal nucleus of the trigeminal nerve, okay, which is capped by, guys, remember, which is capped by, or there is a covering, a cap ऊपर हमें देखने को मिलती है, which is capped by a tract, and this tract, it is called as the spinal tract of trigeminal nerve. It is called as the spinal tract of the trigeminal nerve. Spinal tract of the trigeminal nerve. It is called as the spinal tract of the trigeminal nerve, right? So that is something you have to remember. Now spinal tract of trigeminal nerve basically consists of those nerve fibers which are arising from the spinal nucleus of the trigeminal nerve. Now The most important feature, guys, over here, which you can see. Okay, let me just try to complete this matter, right? And yes, the most important feature, guys, that you can see over here. Yes, it is the pyramidal decussation. It is the pyramidal decussation. Pyramidal tracts, basically they cross over. Okay, they are crossing over the pyramidal tracts. Yes, they are like crossing over like this over here, and like they are over here. Yes, the pyramidal tracts, right? So yes, they form a track posterior laterally, guys. They are going behind and they are like going on the lateral side in the lateral column, and that's why these are called as the, yes, the lateral corticospinal tract. That is something which we have already discussed. This is the lateral corticospinal tract. Lateral corticospinal tract, right? Lateral corticospinal tract. Now वो हमने वैसे भी डिस्कस किया था लेटरल कॉर्टिकोस्पैनल ट्रैक्ट. Now, so this crossing over, guys, this crossing over is something which is you already know, which is called as pyramidal decussation. It is called as pyramidal decussation, guys, right? It is called as pyramidal decussation, right? And guys, below this, just remember, lateral to this gray matter, guys, we have yeah, we have diffused nerve fibers, right? We have some diffused nerve fibers. Remember these diffused nerve fibers, guys, these diffused nerve fibers, this is something with nerve endings. These are called as, yes, these are called as, or let me use another pen, these are called as the reticular, this is something which is called as the reticular formation. Reticular formation. Now, this reticular formation, it is an important feature at all the levels of the brainstem. You will be watching this feature like at all the levels, guys, right? And guys, it is no sometimes it is concerned with awakefulness, right? It's concerned with awakefulness, right? And guys, you already know on the lateral sides, on both the lateral sides, guys, we have these some tracts that you already know that will be visible over here also. Yes, we have the posterior spinocerebellar tract, anterior spinocerebellar tract, right? So this is like everything is like on both the sides. So we have drawn. Yes, we have, yes, posterior, and I will not tell you what it is because we have already discussed this in detail, the spinocerebellar tracts in detail, guys. Yes, the posterior spinocerebellar tract, and yes, we have the anterior spinocerebellar tract. Spinocerebellar tract. And in this column only, guys, you will see one more tract over here. Yes, we have one more tract over here, and that is the lateral spinothalamic tract. The lateral spinothalamic tract. Lateral spinothalamic tract. Right over here, you will get the same thing, the lateral spinothalamic tract. Don't confuse with this. Yes, the lateral spinothalamic tract. It is also present over here also, right? So that is about at the section, the pyramidal decussation, at the level of this pyramidal decussation, how this medulla oblongata looks like from the lower part. If you take a section from this pyramidal decussation, it will look like this. It will look like this. So I hope this is clear, guys. Just give me a thumbs up in the chat box if this picture is clear. The transverse section of the medulla oblongata at the pyramidal decussation, guys. Just give me a thumbs up if it is clear to everyone. Now, yes, I'm waiting for your thumbs up, guys. Yes. Samita, very good. Hmm. चलो शकील, वेरी गुड बेटा. नाउ वी आर गोइंग टू टेक द ट्रांसफर सेक्शन. एक ट्रांसफर सेक्शन ये था. अब हम एक ट्रांसफर सेक्शन वो लेंगे जहां पे हम बीच में से काट रहे हैं बट बिलो द ऑलिव्स, ऑलिव्स के नीचे से कटिंग लेंगे. ठीक है, ऑलिव्स नहीं आएगा उसमें. तो यहाँ पे सेंसरी डेक्यूसेशन होता है, मतलब सेंसरी फाइबर्स एक जगह से राइट से लेफ्ट में जाएंगे और लेफ्ट से राइट में आएंगे. So this is the level of sensory decussation. So let us take one more picture, guys. We are discussing the internal structure at three levels: pyramidal, sensory, and at the level of olives. So we are taking the transverse section of the medulla oblongata. Transverse, yes, section of medulla at level of sensory decussation. Sensory decussation. Okay, it is below pyramids, below olives and above पिरामिडल डेक्यूसेशन. ये बिल्कुल लेवल हम वो लेवल ले रहे हैं जहां पे ये पिरामिडल डेक्यूसेशन के ऊपर है और ऑलिव्स के नीचे है. ठीक है, एंड अबव पिरामिडल डेक्यूसेशन. पिरामिडल डेक्यूसेशन, राइट. नाउ now guys, let us just try to look at this. Now over here at sensory decussation, what happens, we have this gray matter and the white matter. Now the remember guys, the central gray matter. Okay, let us just first draw it. Let us just try to draw it. So I'm trying to I'm trying to keep it very simple, right? So that you guys don't confuse. Right? So yes, just try to make it more curve over here. Now guys, just try to see over here. The central gray matter start disintegrating, right? It will be start breaking down, guys. And remember, it will be forming a central nucleus, guys. Okay, it will be forming a central nuclei, right? Okay. Now what will happen over here? Let us just try to look at this particular image. Yes. Now over here, the nucleus gracchalis. Okay, we have the central canal in between. That is we can't forget what is happening, guys. ये जो पहले इतने बड़े बड़े projections दिख रहे थे ना, ये जो बीच में जो ग्रे मैटर था, अभी बहुत छोटा हो गया, डिसइंटीग्रेट हो गया है. और गाइस, यू विल सी वेरियस न्यूक्लियस ओवर हियर. पहले न्यूक्लियस ग्रेसालिस था, क्यूनिटस था, ये सब यहाँ पे आ जाएंगे, बट विल बी लाइक दे विल बी फॉर्मिंग दिस न्यूक्लियस, राइट. सो yes, we will have this yeah, the nucleus gracchalis over here. Yeah, so over here we will have this. Yes, remember we have the nucleus gracchalis, right? We have this nucleus gracchalis. We will have this nucleus cuneatus. We have this nucleus cuneatus, right? So nucleus gracchalis basically receive fibers from tractus gracchalis. The nucleus cuneatus basically receive fibers from tractus cuneatus, right? And now guys, over here, remember we have the spinal nucleus also, right? We have already drawn these nucleus, right? So we have nucleus gracchalis, nucleus cuneatus, and over here we have the spinal nucleus. So again we will have the spinal nucleus over here also, right? We will have the spinal nucleus over here also, which is now capped by this. Yes, let me just try to draw this Yes. So we have this travel plant flower vlog. Ram Ram. Ram Ram bhai. Hmm. We have the spinal nucleus. Spinal nucleus, guys, right? And over here we have the tract of on the top. We have already discussed, guys. We have this tract of the fifth कौन सी nerve है? Trigeminal cranial nerve. Trigeminal cranial nerve. We have the tract of this fifth trigeminal cranial nerve, right? Now, from the nuclei, okay, the nucleus gracchalis and the nucleus cuneatus, guys. Now, what is happening? What is happening, guys? We have already discussed from there will be some fibers which will be coming onto the opposite side, guys, from nucleus cuneatus and from the nucleus gracchalis. These fibers will be coming on to opposite side, right? Now these fibers are called as the internal arcuate fibers. These fibers which are coming on to these opposite sides, guys, remember, yes, over here also we will have the same thing, right? So yes, just try to like make it more like small, right? Over here we will also have these fibers like coming from the nucleus gracchalis and cuneatus from there, right? So yes, these are called as the internal arcuate fibers. Okay, these are called as the internal arcuate fibers, the green fibers that we have drawn, right? Now they will cross towards the opposite side and they will form a lemniscus, guys, and that is something called as the medial lemniscus, right? So this, yes, so this, guys, you already know this is the medial lemniscus, and obviously these fibers, guys, that you can see over here, these are nothing but the internal arcuate fibers, the internal arcuate fibers. These are nothing but the internal arcuate fibers, guys, right? We have discussed these fibers earlier also, guys. If you just want to see, we have discussed these fibers earlier also, right? Let me just try to show you. You can see these internal arcuate fibers, guys, at the level of the medulla oblongata. From the nucleus gracchalis and nucleus cuneatus, they are going to opposite side, forming the medial lemniscus, that we have already discussed, beta. The internal arcuate fibers. No, they are coming from the nucleus cuneatus, the nucleus gracchalis, and they are going to opposite side, and they are forming one lemniscus, that is the medial lemniscus, that is going to the thalamus, so that is something which we have drawn over there, that is something which we have drawn over here, right? So that is something which we have drawn over here, right? So these are the internal arcuate fibers, and which you can see over here, right? And they are forming the medial lemniscus, Now, central gray matter is basically around the central canal. Now, this is something you already know. We have this, yes, the central canal, right? And we have the central gray matter which is around this, right? The central gray matter which is around this. It consists of certain nucleus, beta, that you have to remember. Yes, it consists of certain nucleus. We have, yes, the dorsal nucleus of the vagus. Yes. So you can just like mark like this. So we have like 3 nucleus, guys. Yes. Yes, full neuroanatomy होगी यार, मैं तो बहुत पेशेंस से करवा रहा हूँ सब कुछ. We are like starting from very basic. पिछले 3-4 दिन से बहुत बेसिक से पढ़ाया. So yes, over here, guys, remember this is, yeah, this is which nucleus you already know. It is the, yeah, the dorsal nucleus of the vagus. Okay, let me just okay. So I'm writing this as 1, right? Then we have 2, then we have 3. So what are these 1, 2, and 3? 1, it is basically the hypoglossal nucleus, right? Just like write down like this. We have the hypoglossal nucleus, okay? Then 2, we have the dorsal nucleus of vagus, dorsal nucleus of vagus. And the third one, beta, remember we have the nucleus of tractus solitarius, tractus solitarius, right? Similarly, we have these nucleus on the other side also. Everything is like present on both the sides, right? So that is something you have to remember. Again, guys, you behind lemniscus, guys, you will see a tract. Okay, behind lemniscus, you will see a tract, guys, over here. On both the sides, you will see a tract, and this tract, beta, remember this is called as the medial longitudinal tract, medial longitudinal fasciculus, or it is called as the medial longitudinal bundle. Basically, it connects the third cranial nerve, the sixth cranial nerve. Okay, no, you already know LR6SO4. The lateral rectus, it is supplied by the sixth cranial nerve. Basically, they are supplying the extraocular muscles, right? The okay, the trochlear nerves, right? Um, the vestibular nerve, the eighth cranial nerve. Basically, it is like the eighth cranial nerve, that is the vestibular cochlear nerve, that is meant for hearing. So that is like these fasciculus, these bundles are connecting these fibers, right? Now, apart from that, we have the spinal part of the accessory nerve, right? We have the, yes, the spinal part of the accessory nerve over here, which you already know. So that is no basically connected by this medial longitudinal fissure, or not the fissure, actually the fasciculus or the bundle. We also can call it as the bundle, guys. The medial longitudinal fasciculus or the medial longitudinal bundle. So the lower part of okay, the lower part basically, beta, you already know we have this, yeah. Okay. Again, in the previous part, we already have seen this reticular formation, guys. These are the blunt nerve endings, the nerve fibers present with these nerve endings. So yes, we have these, yes, these reticular fibers over here also, which is a characteristic feature of the entire brainstem. It will be present everywhere, right? So we have these reticular fibers, guys, right? We have these reticular fibers, which you can see. Again, you can also see over here, guys, the same thing, the same tracts which you can see, right? We already know we have this spinothalamic tract, the spinocerebellar tract, right? We have the spinocerebellar tract, right? We have these okay, the lateral, the spinocerebellar tracts, the anterior. Okay, we have discussed the anterior and the posterior spinocerebellar tracts, which will be like present over here also, right? Which will be present over here also. And let me draw in the same color that we have drawn over here, so that you guys can remember. Yeah, we have drawn with it with the purple color. So yes, so we have the two tracts over here. Yes, the posterior and the anterior spinocerebellar tract, spinocerebellar tract, and guys, we have a tract which is like located laterally also. It is called as the lateral spinothalamic tract, right? We have discussed this lateral spinothalamic tract over here also. So let me use the same color. Yeah, so we have this lateral spinothalamic tract, lateral spinothalamic tract. So that is something that you have to remember, guys. That is something you have to remember. So yes, that is the transverse section of the medulla at the level of sensory decussation, and that is because of the internal arcuate fibers which are forming the medial lemniscus on the other side, right? So that is we have discussed what is lemniscus, kya hai internal arcuate fibers, we have discussed like day before, guys, right? So that is we have taken two levels, guys. We have discussed the sensory decussation, we have discussed the pyramidal decussation. Now I am going to take the transverse section at the level of the olives. I will be taking the transverse section at the level of olives, and this is something that you have to like understand it very clearly, guys. So yes, this is the like more of the tough wala part. So yes, let us just try to simplify it. Yes. Now we are going to discuss the transverse section of olive. Yeah, transverse section of medulla at olive, and remember it is the open part of the medulla. ओपन पार्ट ऑफ मेडुला, नीचे क्लोज था ऊपर आकर ओपन हो गया है, सो वी हैव द ओपन पार्ट ऑफ द मेडुला oblongata, right? We have the open part of this medulla oblongata, right? So now guys, over here first feature that you have to remember that yes, देयर इज नो सेंट्रल कैनाल. अभी हम लोग सेंट्रल कैनाल पढ़ रहे थे बीच बीच में बार बार, सेंट्रल कैनाल यहाँ पे है, पिछले वाले सेक्शन में था. नीचे से ऊपर आते आते ये सेंट्रल कैनाल स्प्लिट कर जाता है, ठीक है, split to form the floor of the fourth ventricle. So remember guys, the central canal basically will split. Central canal basically will split to form fourth floor of fourth ventricle. Floor of fourth ventricle, right? Floor of fourth ventricle. And you already know the central gray matter, जो भी central canal के साथ जो gray matter था, it will split to form the nuclei of the various cranial nerves. Okay? अब जो central gray matter हम लोग बार बार पढ़ रहे थे, the central gray matter will now split to form nuclei of various cranial nerves. Various cranial nerves. Now. Let us just try to see how does it looks like, guys, right? So we already know we have this, the central canal will be splitting to form the floor of the fourth ventricle, and the central gray matter will be now splitting to form the nuclei of the various cranial nerve. Now nucleus, they are present on the dorsal side, guys. They're not present anteriorly. Like most of the nucleus, they will be like more on the posterior side, guys. From anterior to posterior, they will be more on the dorsal side, and from medial to lateral. From medial to lateral. So let us suppose, guys, that this is yeah. Let us suppose that this is the midline, guys. Assume that this is the midline, right? Okay, let me just erase it. Yeah, this is so we have the pyramids below, right? Yeah, before decussation, the pyramids are always like located over here only. So we have these. Let us just suppose that these are the pyramids. Okay, they are before decussation, guys. Decussation has not taken place. They are running along the same side, guys. These are the pyramids, right? And obviously, yes. We are just trying to cover it. So yes, let us just draw the same thing, guys. Okay, right? So again, on the same side, it will be like now from medial to lateral, guys. From medial to lateral, what are all the nucleus, guys, that you will see over here from medial to lateral? The very first nucleus that you will encounter, guys, over here, that is the hypoglossal. Yes, that is the hypoglossal nucleus, right? So yes, We have this hypoglossal nucleus. Let us just try to remember this. This is the hypoglossal nucleus. Hypoglossal nucleus. Hypoglossal nerve nucleus. Now guys, if I ask you, this hypoglossal nerve nucleus will give rise to which cranial nerve? Okay, answer me in the chat box, guys. This will give rise to which cranial nerve? Anyone? It will give rise to which cranial nerve? Yes, Azan, very good. It will give rise to, yes, the 12th cranial nerve. Yes, it will give rise to the 12th cranial nerve. Yes, yes, yes. Travel plant, very good. Now, you guys already know. Yes, I can see Samita also commenting. Yeah, so yeah. Okay, that's right. Now, hmm. Now guys, just lateral to it, we have another nucleus bit over here, and that nucleus, it is called as the dorsal nucleus of the vagus. Okay, vagus is which cranial nerve, guys? Try to comment in the chat box. It is called as the dorsal nucleus of vagus. Dorsal nucleus of the vagus. Right? The vagus is which cranial nerve? Yes, travel plant. Very good. Then we have another nucleus just lateral to it, guys. Yes, we have another nucleus, and that nucleus, it is called as the nucleus of Tractus solitarius. Nucleus of Tractus solitarius, right? Solitarius, right? We have nucleus of Tractus solitarius, and posterolaterally we have, guys, two. Yes, Samita, Shakil, Azan, very good. Posterolaterally we have two nucleus, guys. Okay, on the posterior side, and it's like located on the lateral part. Yes, you already know the name. It is the vestibular nucleus, guys. Yes, we have like two nucleuses over here, and that is something you have to remember. This is the vestibular nucleus. Vestibular nucleus. This is the vestibular nucleus, guys. This is the vestibular nucleus, right? Posterolaterally we have these two nucleus, and that is the vestibular nucleus, guys, right? Now, okay, we also have, okay, one of the nucleus, guys. We also have one nucleus over here, and that is again, you have like seen this in my earlier images also, and that nucleus, it is the spinal nucleus along with the tract of the fifth cranial nerve. Spinal nucleus, okay, and tract of the fifth cranial nerve. Tract of fifth cranial nerve. Spinal nucleus and the tract of the fifth cranial nerve. Now guys, if I ask you, the nucleus of this hypoglossal part will give rise to which nerve? It will give rise to hypoglossal nerve, okay, which continues in the spinal cord as the supraspinal nucleus, okay. Now it gives reference to the first cervical nerve. So remember guys, if I'm just trying to draw it over here, yes, this will give rise to one of the nerve, guys, over here. And remember, this is nothing but this is which nerve, guys? You should remember this is the hypoglossal nerve. Hypoglossal nerve. So hypoglossal nerve will be coming from the hypoglossal nerve nucleus. This is called as the hypoglossal nerve. Hypoglossal nerve, right? Now, the dorsal nucleus of vagus, the nucleus of tractus solitarius. We have one more nucleus, guys, which I have not mentioned over here, right? But just try to remember, there is one more nucleus, no? And these all will give rise to one of the nerve, guys, right? This all will give rise to one of the nerve, and yes, this all will give rise to one of the nerve over here, and that is something called as the vagus nerve. It is called as the vagus nerve. Okay, the dorsal nucleus of vagus, the nucleus of tractus solitarius. Okay, these will all combine and will give rise to one of the nerve that is called as the vagus nerve, right? Now the yes, yes. Again, I'm coming to this point, guys. The glossopharyngeal nerve. Okay, the glossopharyngeal nerve. Okay, and yes, the nucleus ambiguous. Hmm. Now, the glossopharyngeal nerve and the motor part of this fifth cranial nerve, okay, which arises from this no the nerve the nucleus ambiguous. Okay, we have like this okay, the spinal nucleus, guys, you can see, and the tract of the spinal this fifth cranial nerve. Okay, so we have the pyramids like which will decussate. Okay, now in front of these pyramids, guys, in front of these pyramids we have another nucleus that is placed. These are the pyramids. These are the pyramids. You already know the pyramidal decussation. Earlier, before, at the higher levels, it is running on the same side. It is running on the same side. And remember, guys, this is where you will see one of the nucleus over here, and that is called as the arcuate nucleus. Okay, or it is also called as the inferior pontine nucleus. It is also called as the inferior pontine nucleus, no, which displays to down from the pons in front of the pyramids, right? Now the arcuate nucleus gives rise to central no external arcuate fibers, okay, which cross over towards the inferior cerebellar peduncles, right? And lateral to the pyramid, the most important feature, guys, that we have, it is the olivary nucleus, right? We have one like distorted shape is there, guys, which you can see just lateral to the pyramid, and that is like the inferior olivary nucleus, the inferior olivary nucleus, right? Just lateral to these pyramids, we have these inferior olivary nucleus, right? So it is just like appearing like a crumpled bag, okay? And there are two accessory olivary nucleus, guys. There are two accessory ovary olivary nucleus. One, guys, you can see like which is more anteriorly placed, and one which is more like okay, one which is more medially placed. I would say, is, let us suppose this is the midline, guys. So one which is more near to the midline and one which is more dorsally placed. So we have this nucleus, guys, over here, and that is guys, you can just remember the name over here. We have the dorsal olivary nucleus, okay, or I can say yes, the dorsal. Okay, you won't be able to see over here. So let me just write it down over here. We have this nucleus, yes, the okay, that is the medial, okay, that one which is more closer to the midline and more towards front. So yes, we have the medial accessory olivary nucleus, and the one which is more dorsally placed. Accessory means extra than the normal olivary nucleus. So we have the dorsal accessory, yes, olivary nucleus, dorsal accessory olivary nucleus. Okay, now guys, again you can see we have these no the reticular formations are like present everywhere. So you all will have these reticular formations everywhere. So we have these reticular formations, which I told you, these are the nerve fibers which are having these nerve endings, and they are present throughout the brain stem, right? The reticular fibers are present everywhere, right, throughout the length of the brain stem, right? Now, and the medial most feature, guys, over here, just above the pyramids, guys, yes, yes, you have which are formed in the sensory decussation, guys. Sensory decussation में बना था, and I think you already remember this. This is called as medial lemniscus. Okay, this is called as medial lemniscus, guys. This is called as medial lemniscus. जो sensory हमने पहले बनाया था ना अभी ये. We have just seen this medial lemniscus which is formed, right? The medial lemniscus. So it will be formed over here also. Medial lemniscus, right? So we have these medial lemniscus, right? We have these medial lemniscus, which is formed over here, right? Now, so I hope till now it is clear to everyone. Till now it is clear to everyone, right? Mm. Okay. If you want to add, guys, one more thing over here, we have these. Okay, let us just try to look at it. We have these tectospinal tract also. Okay, we have these tectospinal tract also, which are descend from the tectum of the midbrain. So that's why we have discussed this tectospinal tract also. So they will come to this medulla oblongata also, right? The tectospinal tract which descends from the tectum of the midbrain. कल मैंने midbrain का section लेके बताया था tectum, tegmentum, or right? So that is something you have to remember. So also guys, we have these medial longitudinal fasciculus or bundles, right? We have these. Yes, you can just remember, guys, we have these medial longitudinal fasciculus or bundles. Medial longitudinal fasciculus बोल सकते हैं या इसको bundles भी बोलते हैं, right? That consist of like how many cranial nerves? I talked about the third, fourth, sixth, eighth, 11th and 12th cranial nerves, right? So these are the bundles of which are consisting of these cranial nerves, that is third, fourth, sixth, eighth, 11th and 12th. 11th and 12th. So that is about the transverse section at the olive, I mean the medulla. So we have discussed the internal structure, guys. We have discussed the internal structure of the medulla. We have discussed the internal structure of the medulla now. So in the medulla, we have discussed the extent, we have discussed the parts, we have discussed the external features, the anterolateral surface, the posterior surface. We have discussed the internal structure at three levels: at the level of pyramidal decussation, sensory decussation, and at the level of olives. At the level of olives. Now, guys, now over here, guys, just one thing I have forgot to mention this. These are the inferior cerebellar peduncles, and I hope you guys already know this. These are the inferior cerebellar peduncles, basically connecting this medulla oblongata to the cerebellum, right? So we have the inferior cerebellar peduncles, right? So that is something you have to remember. Now, coming on to the blood supply, guys, again I'll be running fast now. Already 2 hours done, and we have just discussed 5 diagrams, but these are words because all of these are very, very important, guys. Now, coming on to the blood supply of the medulla oblongata and applied anatomy. Blood supply of medulla oblongata and applied anatomy. I'm going to discuss some clinical syndromes over here. I'm going to discuss some clinical syndromes. So it is supplied by, remember guys, it is supplied by the vertebral arteries. It is supplied by the vertebral arteries. Okay. Okay, the vertebral arteries, basically what they do, basically they supply this lateral part, guys. They supply this lateral, okay. They supply this, the lateral part, okay, of the medulla oblongata, okay. Now, vertebral arteries, basically they supply lateral part of medulla oblongata. Now, I have already told you guys that this vertebral artery, guys, let's go to the image that is given that we have discussed yesterday. So you can very well see, guys, over here, basically from the arch of aorta, we have this subclavian artery. देखो, left atrium होता है, then we have the left ventricle. Left ventricle से क्या निकलती है? Aorta. Aorta से आप लोग को पता है क्या निकलती है? We have 3 branches, right? Left subclavian artery, left subclavian, left common carotid artery और brachiocephalic trunk. Brachiocephalic trunk will again divide into the right subclavian artery and the right common carotid artery. Now this subclavian artery, it is the one which will be giving rise to this vertebral artery. Subclavian artery से कौन सी artery आएगी? Vertebral artery, and this is the one which is supplying the lateral part of the medulla. So आपको पता होना चाहिए कि when I'm saying this vertebral arteries, the right and the left vertebral arteries, they are coming from the right and the left this subclavian arteries, and they are supplying the lateral part of the medulla. Now guys, again there is another artery called as the anterior inferior cerebellar artery. Anterior inferior cerebellar artery. Anterior inferior cerebellar artery. We also have anterior. Okay, we also have one more important artery that I just forgot to mention. You can remember that we have posterior inferior cerebellar artery. Inferior cerebellar artery, right? We have anterior and posterior spinal arteries. Anterior and posterior spinal arteries. And we also have these basilar arteries. Basilar arteries. Now, basilar artery, guys, you can all see from here also. Now, if I ask you the basilar artery, it is coming from where? You can very well see this is the basilar artery, guys, right? This is the basilar artery. The vertebral arteries, they are joining, right? Yes, we have the basilar artery, and that is also supplying this medulla oblongata. Now, guys, over here, just try to remember. These vertebral arteries, they basically supply the lateral part of the medulla oblongata. Okay. No. Actually, I just forgot to mention these vertebral arteries. Basically, they are not supplying the lateral part. Okay, let me just correct it. These vertebral arteries, basically, they will supply the paramedian region. They will supply the paramedian region. Now, this region, guys, which is located to the midline, guys, this is which is located to the midline. This region, guys. Okay, let me just, yeah. I'm talking about this, which is closer to the midline. This is the paramedian region. So the vertebral arteries will be supplying to this paramedian region. The posterior inferior cerebellar artery is the one which will be supplying to the lateral part of medulla oblongata. It will be supplying to the lateral part of medulla oblongata, right? And remember, guys, the lateral part of the medulla oblongata. Okay, now again, a question over here. If this, if there is a thrombosis, अगर ये आर्टरी ब्लॉक हो जाए, if there is a thrombosis or a occlusion, what will happen? Lateral part of the medulla oblongata में सप्लाई नहीं जाएगा ब्लड का. अगर ब्लड का सप्लाई कम हो जाता है, that is something called as ischemia. Ischemia हो जाएगा. Low blood supply reaching to the lateral part of the medulla, and that will result in a syndrome, beta. That is the syndrome that you have to remember. That is called as the lateral medullary syndrome. That is called as the lateral medullary syndrome. Lateral medullary syndrome, guys, right? Where the lateral side of the medulla oblongata में ischemia हो जाएगा, and all the important nucleuses, guys, which you can see, the vestibular nucleus, they all will be like affected. The spinal nucleus and the tract of the fifth cranial nerve, right? Now again, guys, vertebral arteries, they are supplying the paramedian region. They are supplying the paramedian region. So any occlusion in these arteries, if these arteries are having any thrombosis or any occlusion is there, so you already know if they are supplying the paramedian region, the pyramidal tract will be affected. Okay, the pyramidal tract will be affected, the medial lemniscus will be affected, the tectospinal tract will be affected. So even the medial longitudinal fasciculus or bundles will be affected, which are just along the midline. If the artery supplying to this region, the arteries are blocked, no oxygen carrying blood will be able to reach over here. So all the pyramids, the medial lemniscus, the tectospinal tract, the medial longitudinal fasciculus, they all will be affected, and that will be resulting in a syndrome called as the median medullary syndrome. It will be resulting in a syndrome called as the median medullary syndrome. It will be resulting in a syndrome that is called as the median medullary syndrome, guys. That will be resulting in a syndrome that is called as the median medullary syndrome. Right, so that is about the medulla oblongata, guys. That is about the medulla oblongata, guys. right? So that is about the medulla oblongata. Let us just try to finish the pons also, guys. Let us just try to finish the pons also in a quick way, because we have a lot to discuss in, and everything which I'm drawing and explaining to you. So that will be like, it takes time, and that is yeah. Mira, yeah, this is the thing which I can now do from my side, like to take the classes and like explain you guys. So let us start with the pawns without wasting much more time. Please spend 1 more hour. Listen to the lecture. I'm telling you, it will benefit you a lot, guys. Right? Now, I will be discussing, like I will be drawing. See, I have not make you like write thesis or something. We have just drawn the diagrams, and like I'm explaining you with the help of these diagrams only, right? Like 4, 5, 6 diagrams, but the explanation is important, guys, right? So let us start with the pawns. Now, the pawns, basically, if we talk about the extent, guys, and try to be very quick, guys. Extent, it is from medulla oblongata above, I mean below, medulla oblongata below, to midbrain above, that you already know. पॉन्स के ऊपर क्या है, midbrain above, and it lies in front of cerebellum, and it lies in front of cerebellum. It lies in front of cerebellum, right? It lies in front of the cerebellum. So if we talk about the external features, remember, guys, that we have like two surfaces. We have two surfaces. We have anterior surface and we have posterior surface. एक आगे वाली surface होगी और एक posterior surface होगी. So we will be discussing these two surfaces in detail. We will be drawing diagrams related to these two surfaces. So be very quick, guys. Yes. Now we are going to talk about the anterior surface. The anterior surface, guys. Right? Now, you already know? Yes. Now let us suppose that this is the pons, and lower continuation, it is the medulla oblongata. So this is medulla oblongata, right? You already know, right? So this we have already drawn, guys, right? So we have these pyramids, we have these olives, right? We have these pyramids. You already know what we know from this is medulla oblongata, and over here we have like this is the pons, right? These are the pyramids. If I'm drawing this, I'll just tell you these are the olives, right? This is the anterior median fissure, right? The anterior median fissure. Every time I'm not gonna label it, guys, please try to remember anterior median fissure, right? And guys, let us now just try to discuss what is there in the interior surface of the pons. Now, when you see the ventral aspect of the pons, okay, you see, okay, now before coming on to that, guys, there are some transverse sheath which are present. Now over here, guys, we have a groove over here. We have a depression over here, guys, and this groove which is present like in the medial part, guys, in the just in the middle of this pons in the anterior part, guys, this is the groove which is called as the basilar groove. This is called as the basilar groove, guys. This is called as the basilar groove. Now, when I say basilar groove, guys, obviously this will be, it is a longitudinal groove, okay, in the middle, and it is for which artery, guys? It is the basilar artery. So the basilar artery is the one which will be supplying the pons, and it is passing through this basilar groove. It is passing through this basilar groove. Okay. Now, over here, guys, over here, you can see these. We have some transverse striations, guys. We have some transverse striations, right? Hmm. Now, there are some transverse striations which are actually running like this. or I can simply say that these are transverse streaks. These are transverse streaks in the pons. Transverse streaks. Now, what are these transverse streaks, guys? On each side of the basilar groove, on each side of the basilar groove, guys, you will be okay, which is like these streaks are basically produced by these transverse pontocerebellar fibers. They are produced by the transverse pontocerebellar fibers. I will be coming to this in detail when I will be discussing the internal part. Now, these fibers that collect on either side, they're collecting on the other side, guys. They're collecting on each side, okay, to form the middle cerebellar peduncle. They're forming the middle cerebellar peduncle. You can just draw like this, guys. Yes. These transverse streaks, they are basically more converging towards this. Yes, they are more converging towards this. So they are like converging to form this medial cerebellar peduncle. Medial cerebellar peduncle. Now, now medial cerebellar peduncle, beta, what is it? Medial cerebellar peduncle, it is basically a thick bundle. Okay, it is formed of what? Pontocerebellar fibers. It is formed of the pontocerebellar fibers which collect on the lateral parts. Obviously ये body का midline है तो medial ये हो गया और बाहर वाली side क्या हो जाएगी? Lateral. So this medial cerebellar peduncle, it is formed on which side? The lateral side, right? The lateral part of the pons. So this medial cerebellar peduncle, it will turn backwards. Obviously ये तो एंटीरियर सरफेस दिखा रहा हूं ना, ये पीछे की तरफ टर्न करेगा और पीछे हमारा क्या प्रेजेंट होता है? सेरिबेलम. Okay, the cerebellar hemispheres. So this medial cerebellar peduncle will link this pons into the, yes, the cerebellum. Inferior वाला medulla oblongata के लिए था. Middle cerebellar peduncle, it is for the pons. It is for the pons, right? So that is something you guys already know. Now, when you see the ventral aspect of the pons, you can see only one nerve. Okay, that is coming from this on the very lateral part, guys. On the very lateral part, let me just try to erase this area, and this is something very important. That is all from the lateral part, guys, and that is the thick, yes, the thick okay, that too from the lateral side, from the pontocerebellar angle. And remember, guys, it is at the junction of the middle cerebral peduncle. At the junction of the middle cerebral peduncle, okay, the thickest cranial nerve will come out. The thickest cranial nerve will come out. Can anyone in the chat box tell me which is the thickest cranial nerve which I have to mention over here? Which is the thickest cranial nerve? Anyone? Yes, which is the thickest cranial nerve, guys? Yes, it is the trigeminal nerve. Yes, it is the trigeminal nerve, guys. It is the trigeminal nerve, right? That is the thickest cranial nerve. Okay. Now, it's not that, guys, the trigeminal nerve will come from only one nucleus. There can be multiple nucleus for a single nerve, so no need to worry. So it is coming from the ventral part, from the anterior part of the pons, guys, at the at the junction of the middle cerebral peduncle. The thickest cranial nerve will come out. It is the thickest cranial nerve. The thickest cranial nerve. Now, guys, over here we have to tell about all the three important nerves that are coming out. Okay, all the three important nerves that are coming out. So remember, guys, over here, okay, let me just draw for you guys. Now, this junction, guys, this junction which I'm highlighting right now, okay, let me just highlight first. This junction, it is called as, okay, pons and medulla is there. It is called as the pontomedullary junction. It is called as pontomedullary junction. pontomedullary junction. It is called as the pontomedullary junction. And from this junction, guys, from this junction, basically three nerves are coming out. One, it is the sixth cranial nerve. Then we have the seventh cranial nerve. And yes, we have the eighth cranial nerve. We have the eighth cranial nerve, the sixth, seventh, and eighth cranial nerve. Can anyone tell me in the chat box? Can anyone tell me in the chat box? Yes, about the names of the three cranial nerves, guys? Yes. The sixth, seventh, and eighth. Now, if I just want to write the sixth, seventh, and eighth, they all are coming from this pontomedullary junction. They are coming from this pontomedullary junction, and you guys already know if you have to specifically tell about this, guys, you can very well see the sixth, it is coming from the pons, and it is coming from the level of pyramid. It is coming from the level of pyramid. So the sixth one specifically, it is coming from the ponto-pyramidal junction, because pyramid के ऊपर से आ रही है. Ponto, which part of medulla oblongata? It is pyramid. It is ponto-pyramidal junction, right? Ponto-pyramidal junction. Now, if you see the seventh cranial nerve, guys, it is coming from the pontomedullary junction. We have the pons, and we have which part of medulla? That is olive. So seventh one, I can simply write it as ponto-olivary junction. Ponto-olivary junction, and the third one, it is like the same, the pontomedullary junction. It is same, right? So very closer to the midline, guys, you will be watching these sixth, seventh, and eighth cranial nerve, right? So that is something that we have to remember. In the anterior surface, okay, we have these transverse streaks, which are like these pontocerebellar fibers, which are converging to form the medial cerebral peduncle, which is going into the cerebral hemisphere. In the middle part, in the median part, we have the basilar groove for the basilar artery, and we have these cranial nerves. And the pontomedullary junction, we have this. Yeah, at the junction of the medial cerebral peduncle, we have the thickest cranial nerve coming out, that is the trigeminal. Otherwise, the sixth, seventh, and eighth, they're coming from the pontomedullary junction. They're coming from the pontomedullary junction. Now, guys, coming on to the next one, that is the posterior angle, the posterior surface of the pons. We have discussed the anterior surface. So we have two surfaces, guys. The anterior surface done. Now we will be discussing about the posterior surface. The posterior surface of the pons. Now let us just discuss the posterior surface of pons. The posterior surface of the pons. Now look at the posterior surface, guys, of the pons. I have removed the cerebellum. I will be now coming on to the obviously the floor of the fourth ventricle, guys. I will be coming on to the floor of the fourth ventricle, guys. You already know we have the same structure, guys. Again, we have the same structure again, guys. We have the superior cerebellar peduncle, right, which is converging downwards. From the inferior part, we have this, yes, the inferior cerebellar peduncle, and they're converging on to the medial cerebellar peduncle, guys, right? So that is something you already know, right? Please make it in the form of a rhomboid, guys, right? Make it in the form of a rhomboid. So that will be like more easy, guys, because the floor is just like this, right? Okay, my tab is like very much annoying right now. Yeah. Now, let us just try to draw it more nicer, guys, right? So now, in the middle, guys, in the middle, you already know we have this medullary streak. We have this medullary streak. right? We have these medullary streak, right? So these are the transverse fibers which separate the posterior surface of, yes, above we have the pons, right? And below we have the medulla oblongata. And this is like the fourth ventricle, the floor of the fourth ventricle, guys, right? Now guys, over here, in the middle, guys, you will see an eminence, right? Okay, over here in the midline, we have yes, we have a sulcus, guys, that is called as the median longitudinal sulcus, right? So I'm just trying to write it over here. It is the median longitudinal sulcus, medial longitudinal sulcus, which you can see over here, right? The medial longitudinal sulcus is there, right? And we have these median eminences, guys, over here, right? We have obviously this sulcus, it is in the midline, the medial longitudinal sulcus, and just lateral to it, we have these medial eminences over here. We have these medial eminences, right? These are longitudinal elevations, guys, on either side of the median sulcus. Okay, they are produced by the abducent nerve, and they will be resulting in something called as the facial colliculus. Okay, they will be resulting in something, or let me just try to make it more above, guys. Yes, they will be resulting into something called as this facial colliculus, guys. Okay, so this is nothing but the facial colliculus, the facial colliculus, right? The facial colliculus, and these are above. We have these red color lines. These are the medial eminence, and that is the longitudinal elevations just lateral to this median sulcus, which are produced by the abducent nerves, right? Now this facial colliculus, now let us have something more special about these facial colliculus. Now these facial colliculus, guys, remember, these facial colliculus, these are the rounded swellings. These are the rounded swellings on the lower part of median eminence. Now guys, there is one question that they always ask, that these are produced by which nucleus, guys? These are produced by the facial nucleus, which encircles the abducent nucleus, Okay, now before that, just if you want to mark, this is the superior cerebellar peduncle, inferior cerebellar peduncle, this is the middle cerebellar peduncle, that we already know, right? So that is something you guys already know. So yes, over here we already know we have this, yes, the sulcus limitans. Yes, the sulcus limitans, I already told you, is developing part of the from the notochord. It's dividing into ventral and the dorsal part, right? So this sulcus limitans, yes, just medial to the sulcus limitans, we have these facial colliculus, guys. We have these facial colliculus, right? And below this facial colliculus, guys, you can see one triangle over here, right? And that is something called as the hypoglossal triangle. Hypoglossal triangle, and which is because of this, like, the hypoglossal nucleus, over here, hypoglossal triangle, because of this hypoglossal nucleus over here, right? Now now that is something that you have to remember in this no or posterior surface of the pons, and that is like, you can just remember. And I will be talking about this facial colliculus in detail in the, yeah, the internal structure. So I hope you guys are not tired, guys. Just give me a thumbs up if you are with me, if you are listening to me. Yes, please give me a thumbs up. We'll be discussing in shortly about the internal structure also. Yes, that is like we can't skip. That is something like we cannot skip actually. Hmm. चलो बताओ फटाफट से, just give me a thumbs up guys if you are available listening to me. Hmm. Sure. I hope you all are alive. Now, let us try to discuss the internal structure of the pons, guys. This is something that I wanted to discuss, and yes, internal structure of the pons. I'm writing below so that we have the internal structure of pons, and that too at two levels, guys. I will be taking at. Okay, I will be taking at like one level. I will be taking at the inferior level of the pons. If I just try to show you at what two levels I will be showing you guys, right? Let us suppose this is the pons, right? And below we already know we have the medulla oblongata. So I'm going to take one level below and one level like above, right? So we have two levels. So the first level, it is the superior level of Pons, superior level of Pons, and the other one, it is the inferior level of Pons, inferior level of Pons. So we have the superior level and we have the inferior level of the Pons, right? Now, firstly, I will be discussing the firstly I will be discussing the inferior level of the Pons, right? So put the heading as the inferior level of the Pons. So we are discussing the internal structure and we are taking the inferior level of the Pons. At its lower level, beta, it has got two major parts, right? So just try to look at it. Yes, we have the two major parts, guys, over here. We have the two major parts. Yes, one part, okay, that is called as the basilar part, right? One part we have the yes, the basilar part of the Pons. These are all converging towards the middle cerebral peduncles, right. So yes, we have the basilar part of the Pons, right? So we have this part that is the basilar part of the Pons. So first I have cut the Pons from the lower level. So I'm discussing the inferior level of the Pons, and this inferior level has two parts. We have the basilar part of the Pons, right? We have the basilar parts, right? And yes, above we have the tegmental part. Above we have the tegmental part. Let us just suppose that this is the midline. Yes, we have these. Yes. Yes, this is the tegmental part of the Pons. Tegmental part of the Pons. Tegmental part of the Pons. So you can just extend it to like more if you want. So now at the lower level, it has got the two major parts, the basilar part from where the ventral part and it's like the ventral part, right? The basilar part, I can also say it as the ventral part, and the tegmental part, it is the dorsal part. It is the dorsal part. Obviously, we are going from anterior to posterior, right? We are going from anterior to posterior, right? Now, let us just try to see. Now, basilar part is common at all the level of bones, whether it is superior, middle level, or the inferior level. Basically, we are taking from two levels only. So it is like common at all the level of bones. Only the tegmental part varies, right? At different levels. So the basilar part has basically three important no components. Firstly, that you have to remember, guys, over here, just hmm. Over here, remember the three important components. We have these longitudinal fibers, right? We have these longitudinal fibers, right? Now, hmm, let us just try to draw it. Yeah, and we have, okay. Let me just try to draw it. We have these longitudinal fibers beta over here. I'm just trying to make it like over here. Longitudinal fibers, obviously in the cross section, they're coming like straight, top to down. I'm just trying to draw it like this. So these are the longitudinal fibers. Longitudinal fibers. We have like fibers in the middle, that is called as the transversely running fibers in the middle, right? We have these transversely yeah, the transverse fibers, right? So we have these transverse fibers, and guys, it will be like present everywhere. These what I say, the longitudinal fibers, all the part of this the basilar part, right? In all the basilar part it will be present. And guys, remember, we have these pontine nucleus, which you can see over here. We have these pontine nucleus, right, which you can see all the way over here. So these are the pontine nucleus. So these are nothing but the pontine nucleus. So in the basilar part of, right, at every levels of the pond, right? So we have this basilar part, which will have these transverse fibers, longitudinal fibers, and these pontine nucleus, the pontine nuclei. Okay. So now remember, guys, these longitudinally running fibers are actually the descending fibers. They are coming from top to bottom, right? They are running from down from the cortex to the spinal cord. Okay, as corticospinal fibers. Okay, they are running from top to bottom, and they are running as corticospinal fibers. Running as corticospinal fibers. Okay, which end up in the motor nuclei of the medulla oblongata. We already know, right? And some are no. These corticospinal fibers, no, they continue down in the pyramid as in the medulla oblongata, right? Now, guys, transversely running fibers, no, which you can see over here, these transverse running fibers. Now, these are pontocerebellar fibers. These are nothing but these pontocerebellar fibers, which we have just discussed over here. These are nothing but the pontocerebellar fibers. Pontocerebellar fibers. Okay, they arise from the pontine nucleus, guys. They arise from the pontine nucleus, and obviously, guys, you already know they run cross. I mean, they cross and go to the opposite side, and to form the, obviously, you already know we have something called as the medial cerebellar peduncle. The medial cerebellar peduncle. Obviously, we were discussing this earlier also. ये जो transverse streak है, these are the transverse pontocerebellar fibers which are going and converging to form the middle cerebellar peduncle, right? So that is about the transverse fibers. Okay, so the middle cerebellar peduncle, basically, if we talk about the middle cerebellar peduncle, basically it consists of mainly these pontocerebellar fibers. Okay, it consists of mainly this pontocerebellar fibers. Pontocerebellar fibers, right? It consists of mainly the pontocerebellar fibers. Now, these pontine nucleus, guys, which is an important component of this corticopontine cerebral pathway, right? The cerebral tract. So these pontine nucleus, guys, remember these are an important component. Okay, important component of this cortico pontine or cortico ponto cerebellary tract, cerebellary tract. So there are an important component of this cortico-pontocerebellary tract, right, which will travel towards the middle cerebral peduncle, right? So some pontine nucleus, no, they are displaced down to continue as the arcuate nucleus, no, which are I already told you which are present in front of the pyramids, okay, which are these arcuate nucleus I'm talking about, which are, so these are nothing but these pontine nucleus only. So some pontine nucleus, they are displaced down, which continue as the arcuate nucleus, which are present in front of the pyramids in the upper part of the medulla oblongata, right? The open part or the upper part of the medulla oblongata, right? So that is something you have to remember about this the lower basilar part. Now coming on to the tegmental part of the pons, guys, you already know. In the tegmental part, guys, we have the nucleus. It consists of several nucleus of the cranial nerves, okay, and white matter. Now we have the sixth cranial nerve nucleus. Status, guys, you have to remember over here. Yes, we have the abducent nerve nucleus, right? We have the facial nerve nucleus, right? We have the facial nerve nucleus. Yes. Hmm. I hope you guys are alive. You guys are listening to me. Just please let me know if you are alive listening to me. Yes, we have the facial nucleus over here. So let us just try to like mark it one by one. So this is the abducent nucleus. Mondru Riti, very good. We have this another nucleus over here, guys. Status again the facial nucleus. The facial nucleus, right? We also have the vestibular nucleus, guys. You already know we have the two vestibular nucleus. We have discussing it like hell from the starting. Yes, we have the two vestibular nuclei, guys, which you can see over here, the vestibular nuclei. Yes. Now guys, we also have, yes. We also have two nucleuses over here, guys, right? Let us just try to, yeah, make it more, yeah, convenient. We have these two cochlear nuclei, guys. We have these two cochlear nucleus, right? So the dorsal, which is like posteriorly, tegmental part is before, so dorsal and anterior. Okay, this is anterior, this is dorsal, and ventral cochlear nuclei, right? And yes, yeah, and it is just in between the inferior cerebellar peduncle, right? So we can just mention it over here. Yes, the inferior cerebellar peduncle, guys, the inferior cerebellar peduncle. Now, abducent nucleus beta lies beneath an elevation and like below the floor of the fourth ventricle, and that above part, guys, it is just lying below the floor of the fourth ventricle, and this elevation, guys, that is due to this part over here, this abducent nucleus over here. This is something called as the facial colliculus, जो मैं बार बार बता रहा था तुम लोग को, facial colliculus. अब facial colliculus, ये जो हम लोग बार बार पढ़ रहे थे, this facial colliculus, guys, this is the facial colliculus, that is the floor of the fourth ventricle. Okay, that is forming the floor of the fourth ventricle, and that is basically due to this facial colliculus, guys, right? So the motor fibers of the facial nerve which winds around the abducent nuclei. So basically there are the motor fibers which will go and they will wind around this abducent nuclei, okay, forming an elevation. Elevation It is because of this facial nucleus. These From the facial nucleus, obviously the facial nerve will go and it will wind around this abducent nuclei. Okay, and then it will come like down like this, right? Now this winding around will create an elevation on the floor of the fourth ventricle, and that is something called as the, yes, the facial colliculus, which is called as the facial colliculus, guys. So yes, that is something you have to remember. During embryogenesis, guys, remember this facial nerve nuclei. It is present dorsolateral. ये ना पीछे की तरफ होता है, ठीक है? It's just on the posterior side, guys. Okay. Now what is happening? This facial nuclei, it is like dorsolateral to this abducent nuclei. ये बिल्कुल इसके पीछे होता है, guys. Later on, this facial nerve वो ना migrate करके आगे की तरफ आता है. Okay, downwards and towards the middle part. Okay, to that of the trigeminal nerve nuclei. Okay, it is like closer to this trigeminal nerve nuclei. Now over here, guys, you remember we have this, yes, the trigeminal nerve nuclei. Trigeminal nerve nuclei. It is closer to this trigeminal nerve nuclei, guys. And remember, guys, to no actually have some quick responses, guys. Obviously the motor part is here, the sensory part is here. If they are like situated no away from each other, obviously there will be a delay in the reflex. Okay, so to avoid that delay, basically this facial nucleus has come down no closer to this trigeminal nerve nucleus, and that is why it is taking a turn around the abducent nuclei, and that turn has created a bulge on the fourth floor ventricle, and that bulge is something which is referred to as this facial colliculus. Okay, so this facial colliculus, under this which nucleus is present, it is abducent, guys. But this bulge, it is created due to this particular nerve. Okay, so this kind of migration no of motor nerve nuclei or towards the sensory part. Okay, so that is something called as neurobiotexis. That is something called as the neurobiotexis. Okay, so that is something you have to remember over here. Now facial and the abducent nerve, guys, if you just see, we have just taught the facial and the abducent. The abducent is the sixth, the seventh is the facial. They both arise from the spontomedullary junction, right? The trigeminal, basically it is no along with the tract of the trigeminal nerve. Okay, it is like more onto the junction of the medial cerebral peduncle, the cerebellar peduncle, right? So now there are other nucleuses which are not present to this over here, and that is like you can just remember the medial nucleus that are present to this facial nerve, guys. That is again you can remember over here. Yes. Okay, we have the superior salivary nucleus. We have the, yes, just a moment. We have various nucleuses, guys. You already know we have the superior salivary nucleus, which is like, yeah, lateral to this facial nerve, guys, right? So we have this superior salivary nucleus. Okay, we have this inferior salivary nucleus, right? So we have superior salivary nucleus, inferior salivary nucleus, which are present, right? They lie basically, okay, not exactly over here, but it's just lie medial to this, no, the facial part, guys. So the okay, you can just make it over here. Yeah, so they are just lying medial to this, yes, facial nerve, the superior salivary nucleus, the inferior salivary nucleus. They are lying just medial to this facial nerve. Okay, towards the midline they are lining, right? So again, guys, you already know the white matter consists of this medial longitudinal bundle or fasciculus, right, which is present in the paramedian part, okay. So that is something I don't have to tell you, right? We have other tracts which are present in the paramedian part, the tectospinal tract, the rubrospinal tract, right? So yes, if you just want, we can just mention it. Yes, we have the medial longitudinal bundle, right? The medial longitudinal bundle. Then we have this, yes, tectospinal tract. I'm just writing in short. Then again we have this, yes, rubrospinal tract, rubrospinal tract. Now, you already know the medial lemniscus. It is basically formed uh, in the sensory decussation of the medulla, right? So we will have these medial lemniscus over here. We have this medial lemniscus, that is formed as a sensory decussation in the medulla. We have already done this, and lateral to this medial lemniscus, guys, we have the spinal lemniscus. Okay, on the sides we have these spinal lemniscus, which is now formed by the fusion of two anterior and posterior spinothalamic tracts, right? It is formed by the fusion of two anterior and posterior spinothalamic tracts. Again, in the lower part, guys, you will encounter a body over here, and that is again called as the trapezoid body. This is called as the trapezoid body. Now, this trapezoid body, it is formed by the decussation of the fibers which are coming from the cochlear nucleus. Okay, they are running transversely to decussate to the opposite side. Okay, so that is it is formed by, okay, if you just want to write it, it is formed by decussation. It is formed by the decussation of the fibers coming from cochlear nucleus. Basically, they run transversely to decussate to the opposite side. Okay, so that is regarding the transverse section from the inferior level of the pons. That is the transverse section from the inferior level of the pons. Now coming on to the transverse section from the upper level, and guys, if you just want, you can just remember over here, we are taking the transverse section from the superior level. Obviously, the basilar part will remain the same. Okay, the basilar part will remain the same, and I'm just telling you in short, in detail, not in that much detail, guys. I'm not telling in that much detail. So just try to remember, guys, over here. Yes. So yes, we we are just trying to see over here. Yes, the basilar part will again remain the same, right? Over here we have the basilar groove, right? We also have this basilar part that will again be the same in the, if we take the transverse level from the superior level of the pons. So we are seeing the superior level of the pons over here, right? So yes, only difference is, guys, from the inferior to the superior level, it is in the tegmental part. Guys. The tegmental part. Right now in the tegmental part, we can see difference in the cavity of the fourth ventricle, guys. Let us suppose that this is the cavity of the fourth ventricle over here, right? This is the cavity of the fourth ventricle, right? This is the cavity of the fourth ventricle, which is covered by the, okay, which is covered above by the superior medullary venom. Right? Which is covered by the superior medullary venom, no, which actually makes the roof of the fourth ventricle. It makes the roof of fourth ventricle, right? So on either side, basically the cerebral peduncles are molded. Okay, the cerebral peduncles, which you can see over here. Yeah, we have the superior cerebellar peduncles, which are like molded, right? Now, guys, we have these like nucleus coming over here, guys. We have the nucleus which are now coming over here. And over here, you know, we have the 8th vestibular cranial nucleus. Okay, we have this 7th, 6th cranial nucleus. these all nucleuses are guys like absent at this level. They are absent at this level. Obviously, if you just see guys, if we have drawn this transverse section, this 6th, 7th, and 8th nucleus will be comparatively absent in the upper part of the in the upper part. If I'm taking a section from the upper part, guys, obviously it will be absent. It will be absent. Lower part पे present होगा ना, तो upper वाले part में तो completely absent ही होगा, right? Upper वाले part में तो completely absent ही होगा, right? तो upper part में तो हमें दिखाई देगा ही नहीं. Upper part में तो हमें दिखाई देगा ही नहीं, ठीक है? Now, obviously क्यों दिखाई देगा? Because वो तो नीचे से आ रहा है ना. अपर वाले सेक्शन में तो दिखाई देगा नहीं, तो अपर सेक्शन का हुआ है, ठीक है? Now guys, you already know only trigeminal nucleus is like more prominent over here, okay? With a motor nucleus of trigeminal nerve, mesencephalic nucleus is there, sensory nucleus is there. So we have like all these three nucleuses which you can see over here, okay, on the lateral side, and like all these three nucleus, the motor nucleus, the sensory nucleus, okay, and the mesencephalic nucleus, they all together will be giving rise to one of the nerve that is called as the trigeminal nerve, okay. It will be giving rise to one of the nerve that is called as the trigeminal nerve, okay. It is giving rise to one of the nerve called as the trigeminal nerve, okay. It is giving rise to one of the nerve that is called as the trigeminal nerve. Now the principal sensory nucleus of the trigeminal nerve now basically continues below as the spinal nucleus of the trigeminal nerve, okay, and it continues above as the no mesencephalic nucleus of the trigeminal nerve. So yeah, so these nerve fibers, no, which are arising from this nucleus, they all converge together and they come outward as this no trigeminal nerve. They come outward as this trigeminal nerve. Okay. So coming on to the white matter, guys, you already know we have all the tract guys over here. We already know on both the sides we have the medial longitudinal bundle, okay, the tectospinal tract. Again, I'm not talking about that, okay. The rubrospinal tract is there, right, and medial lemniscus, spinous lemniscus, everything is like present over here, okay. So that is something you have to remember. Okay, now after that guys, let us we have just in short discussed about this, right? Now even guys, you will have this trapezoid body which I have discussed over here, the cochlear fibers after decussating, which will form the trapezoid body, okay. And yes, they know these trapezoid bodies basically they form a tract, no, which will ascend upwards to the inferior colliculus of the midbrain, and that is called as the lateral lemniscus. So yeah. Now coming on to the blood supply of the Pons, and just in short, I will be discussing about the blood supply. Blood supply of Pons. Remember, basically direct branches of which artery, guys? Obviously the basilar artery. Direct branches of basilar artery, right? Basilar arteries, which I have already talked about, that it lies in the basilar groove, right? Branches of this basilar artery, they are called as pontine branches. They are called as pontine branches, which supply most of the anterior part of the pons, right? So pons is also supplied by one of the arteries, guys, that you have to remember, that is anterior inferior cerebellar artery, okay. Anterior inferior cerebellar artery. So that is regarding this pons and medulla. Today we have discussed a lot about this pons and medulla. So yes, we have discussed about the medulla oblongata, the extent, the parts, the external features, the surfaces, okay, the internal structure at different levels, and we have discussed the blood supply along with the clinical anatomy, and also the pons, the extent, the external features, the posterior surface, the internal structure at two levels, the superior and the inferior levels, guys, and the blood supply. So that was regarding today's class, and I hope you all enjoyed it. I know it's a bit tougher part, but as you guys like will continue to clear your concepts, it will be like the more you draw, the more you write, the more you will learn. Thank you. Thank you guys for your patience, for listening me out. Okay, if you like want the notes, you can join my Telegram group. Okay, the Telegram group, that is Docs Mayan. That is the Docs Mayan. Or if you have any doubt, guys, you can just directly text to me on my Insta. That is Abhijeet Kumar 7859. Abhijeet Kumar 7859. Yes. So that is the easiest way to reach out to me. Thank you guys. Thank you.